today is customizations in the system. Who would like to, I guess, who's sitting with Doctor?
Nobody right now. He's roaming. He's in there with Cindy, I think. Cindy, is he with you?
Yeah, this is mine.
Okay. Who would like to do the driving for the customization portion?
We'll let Tammy do it.
Okay. So I'm going to send you a little pop-up on your screen that asks you to share your screen, if you would, please.
Yeah.
Everybody will be watching Tammy's screen. So we can see your screen if you want to get logged into Foxfire, please.
Where'd my icon go? Oh, there it is. Cindy.
Yeah.
Why is my Foxfire icon not on here?
There.
Oh, that's what it is. Hold on a minute. Yeah, it's not on here. Do none of this.
Applications.
Oh.
Right here, and just pull it down to the bottom. Click
This
on
one?
it and
This
pull
one?
it.
Ooh.
And then just pull it down to the bottom.
Right here?
Yeah.
Okay, there we go. Sorry, usually when I'm working on it, I'm in the back.
That's okay.
Really?
It looks like your caps lock is on.
The light thing wasn't, it's backwards sometimes. Sometimes it's backwards, sometimes it's not.
I thought that was just me.
Do you want me to get it into EyeMD EMR or the?
Nope,
Okay.
we're going to be working in EyeMD EMR today. We'll probably get through it before the end of the day, but that'll give you plenty of time to go through and do some practicing. And we're going to go ahead and pull up one of the Foxfire patients that we've been working on. And by the end of the day today, these Foxfire patients will be deleted from the system because your interfaces will be on here shortly, and all the patients from the PM side will be sent over. So you will be able to work in your practice management here this afternoon. So you'll be able to practice adding patients, editing patients, searching patients, and setting up your calendar.
Okay.
So when we do customizations within the system, it doesn't matter what patient you use or when you do it, the customizations that you complete on any of these patients are for the entire system. So even if we do customizations on this Tammy Foxfire patient who's later deleted, the customizations will stick. So I'm going to have you go ahead and add a new visit. Actually, before we do that, I'm going to teach you how to change a few things on a visit. Go ahead and select the comprehensive visit from the 7th. So this is a visit that's already completed. What we want to do is I want to say change the visit type or the date of service. To make any changes to those types of options on the visit, you're going to hit the blue edit button at the top of the screen. This blue edit button only ever needs to be clicked if you are working in an exam that is not today's date of service. So if it was yesterday's or any time prior to that, the system is requiring an edit trail. So you hit the edit button and it opens up the fields and allows you to make changes as long as the chart has not been signed. So go ahead and click edit. What this is going to do is open up a button at the bottom right-hand side of the screen called Edit Visits underneath of the provider location and patient exam type.
Let me go ahead and click that.
Yep. So this screen should look very familiar. This is the Edit Visit or Add New Visit screen. This is the button that we originally clicked to add a new visit. If you wanted to delete the visit, let's say you started a visit before a patient came in and you were doing what we call backfilling and filling out, maybe pulling their history forward and extracting their medications, and then they were a no-show, you'd have to delete that visit from the system. And to do that, you would click the Enable Delete check mark. We're not actually going to delete it, but I'll show you there's a couple steps you have to take anyway, so go ahead and check the box. Checking the box activates the Delete Visit button, and if you click Delete Visit, it's going to ask you if you're sure you want to delete it. So go ahead and click that just so you can get the muscle memory for it. And then we're just going to hit No. So if you wanted to delete that visit, that's how you would do that. So go ahead and select your visit again.
I have a question, Morgan. On this screen right here where it shows the entire visit, is there any way to make that larger?
There's not at this time, no.
Okay.
That was one of the enhancement requests we sent over last year, so depending on what the new version looks like, we may or may not have that coming for us.
Okay.
Go ahead and get that Edit Visit button open again.
Okay.
Click the Edit Visit button.
Oh, sorry. I did it at the top, not the bottom.
Let's go ahead and change the date of service to today by either clicking on the date on the calendar, or I always just click the Today button underneath of the calendar. Yep. So if, let's say, you started this visit out as a post-op or a contact lens check, and it ended up being a whole comprehensive visit, this is also where you can change the visit type. Or if while practicing you forget to click the check mark for Test Exclude Visit and you think, oh, I really need to get back and do that to make sure it's done, you would come back in here and just check that box. So this is where you would pull up the Add New Visit screen to review or make changes, edit, or delete. When you're finished, you'll click the Update Visit button. Perfect. So now this visit is with today's date of service. One thing that I just want to touch base on is on the visit summary screen. There's two red bars across the top under the first and second columns. This is where when the doctor is signed in, the doctor needs to check these what are like ovals. So when we check them, it's not going to mark them off, but we'll kind of go through that when is he with us yet?
Yes, he is. He's
Okay.
sitting with me.
Perfect. Do you want to go ahead and log off and have Doctor log in, please?
Sure.
Morgan, I have a question.
Password different on this because you logged him in under this the other day, or it's just still the 1, 2, 3, 4?
No, I emailed him his password.
Oh, hold on.
Morgan, I have a question while they're doing that.
Sure.
Just to be sure, when you go in to edit a chart, you can only edit it if it has not been signed yet. Is that correct?
That's correct, yes. Once the doctor has signed the chart, information in the chart cannot be changed.
Okay.
Great question. So doctor, once you have your technician work up the patient, and the very first thing you see is the visit summary screen, at the top of those first two columns where it has a red bar with a gray oval in them, go ahead and click on that gray oval. Basically what that's doing is saying that the doctor did check the HPI and the history. So those two buttons are very important. You can do them at the very beginning and say, yep, I reviewed these. If you go to sign the chart, it'll stop you and say HPI has not been reviewed to give you a warning. You can certainly override it, but you will always want to make sure these are checked. So just kind of pay attention to that warning if it ever reminds you.
Okay.
All right, so what we're going to do in the next hour or so is we're going to walk through the process of customizing the exam screens. After that, we're going to go through and customize some additional pieces that are outside of the exam. So we're going to move in the process of the exam. So we're just going to go down to the HPI/Tech tab. So the first screen is your chief complaint or HPI. Go ahead and hit the double drop down next to the chief complaint.
Do I need to leave Dr. Bitzel logged in, or do I need to log on, or does it matter?
It doesn't matter.
Okay. So chief complaint, and you said do what? I'm sorry.
Go ahead and select, yep. So the way to customize this screen is at the bottom left-hand side of the screen. Hit the little edit button below the chief complaint column. This will allow you to do an add, edit, or delete in every single one of the columns. So for example, if you were to click on blurry vision at the very top, this is currently what's built in all of the columns for blurry vision: quality, modifying factors, context, associated signs and symptoms. If you wanted to add additional items in here, you would just click on the appropriate column and hit the add button from below. That will allow you to add a selection in that particular column as it relates to the chief complaint you have highlighted. So if you click a few of those chief complaints, you'll notice that each of these columns has different items in them. So one of the things that you may want to do is check the list of chief complaints on the left. From that list of chief complaints on the left, how I customize and recommend to do it is always start by deleting what you're never going to use to kind of clean up the system. So that's just an option that you can certainly use. The next thing that I would do is do what we call a priority. So you can see that blurry vision is at the very top, and then it has a dark black line called non-priority. What we've done is we've prioritized blurry vision. So your most common chief complaints are at the top, and you're not scrolling through a whole list to find them. So go ahead and find another chief complaint that is a very common chief complaint when a patient comes into your office. Once you have it, hit the edit button just below the column. Anytime that you highlight an item and hit edit, that prioritize checkbox automatically appears. If you click the OK button here, monitoring of glaucoma is automatically going to go to the top in alphabetical order. That is how you will put your list of 5 or 10 most common chief complaints at the top of your list. My suggestion for customization is to prioritize your list of most common chief complaints and concentrate on customizing the columns for those particular chief complaints.
Okay.
So I'm going to give you a few minutes, probably like 10 minutes or so, to kind of go through and customize these and make sure that like each of the columns is built.
The ones that go with it over to the side, the modifying factor?
Everything. Yep, the entire screen.
Okay.
So that one doesn't have a lot built in it. So if you wanted to customize monitoring of diabetes, you have to hit edit, and then if you wanted to add a quality, modifying factor, context, or associated signs and symptoms, you would hit the add button.
Okay.
And then add a new quality and hit OK.
Okay.
And I'm going to pull up side by side a customer on my end that's done quite a bit of customizing and just see if there's some suggestions for some of your most common ones.
Why don't we start there? It'll give us something to work with,
yeah,
so that we're not trying to create out of nothing.
Oh, sure. Okay.
That screen right here, because when I click OK, it won't. Oh, okay. Never mind.
Yep.
Let's see. Diabetes would be a good one.
Sure. Let me see if I can find a client that has some of that customized. It's just going to be hit and miss. We have quite a few of them, but I'll see what I can find.
This is one Jessica planned the other day and saw it didn't make sense.
Okay.
Under this.
So they have, the one I happen to be on now has a diabetic eye exam. So they changed theirs from monitoring of diabetes to a diabetic eye exam as the chief complaint.
I like that.
So we could go ahead and change that. And then what they did is they actually kept quality modifying factors and context blank and just added a number of associated signs and symptoms. But let me take a look. I wanted to see down below non-priority, there is a diabetic eye exam option. Let's just see if that one already has some of these options built.
Oh, well, I just edited monitoring diabetic eye exam to that. I think that's the one I just changed. Oh, yeah, because that's what me and Jessica was looking at the other.
So this one has more of a list. So my suggestion would be if I would delete the diabetic eye exam and then prioritize this one. I'm going to pull up one more clinic and see if they have anything additional. Oops. Whoops.
Because this is what we were planning. She's pulling up any other doctor's account. And then we can look at whatever we had in our to the way
It looks like for the diabetic eye exam, the two clinics that I'm looking at who have probably the largest patient volume that we see have those options built in, and they've just left it the way that it is.
Well, let's see, we're going to need 4 HPIs. So it would be good to have something under those drop downs for HPI. Like,
well, keep in mind this is just the left-hand side. Go ahead and hit the save button.
okay.
So when you're completing, save at the top right. There you go. When you're completing an HPI, we still have to do this right-hand portion, severity, location, timing, and duration. You'll complete these as well for each HPI. What we're customizing now is just the left, chief complaint, quality, modifying factors, context, and associated signs and symptoms. So if you did chief complaint and associated signs and symptoms, you still have the 4 on the right-hand side to complete.
Thank you.
Okay.
Thanks. Yep. Yeah.
Of course.
Okay.
So
I remember that the other day.
Let's go back and let's look at those associated signs and symptoms, Tammy, and let's see what. Let's see, blurry vision. Yeah, I think that's a good starting point.
Yeah, we don't have like history of NPDR. I see that needs to be added.
Yeah. But then, yeah.
So how do I edit the associated signs and symptoms column, Morgan?
The same way. Hit your edit button at the bottom left.
Oh, okay. I see it now.
And then hit,
okay, and then go here and hit edit under this column.
well, you'd actually hit add if you want to add a comment. Edit means you highlighted one and you wanted to edit what was highlighted.
Highlight history of VDR and let's put history NPDR.
Yes, that history of VDR, and then edit.
And put
NPDR.
Yeah. Oops. Right. Let's see what else.
Okay. Oh look! Oh, never mind. Scratch that.
Monitor blood sugar. I think that's a good starting point there.
So save.
Well, at this point, what I would do is just move to the next chief complaint and then customize that one. So like monitoring of glaucoma. Let me see if either of these guys have anything. Glaucoma. They have a couple associated signs and symptoms like elevated intraocular pressure, intolerant to medical therapy, progressive visual field defects as some of the options under there. But it looks like some of those are built in the glaucoma evaluation, which is already built.
different one. Let's see, done, glaucoma.
You actually don't have to click done in between there if you want to keep that open, just to avoid a couple extra clicks. So
Okay,
that
thank
one, I think what they did is they just changed, they didn't use monitoring of glaucoma, they used glaucoma eval, or you could change it, and then used what was built in there. And just so you have an idea, one of the clinics I'm looking at, we actually copied their database after they spent quite a bit of time customizing. So some of these customizations are going to be exactly what they have because this is a copy of their database.
Pull up glaucoma evaluation, Tammy.
Okay.
And under context, I think let's, with this, normally we have on our chief complaint, we have doctor-ordered exam, our doctor-ordered visual field OCT nerve today.
Add that, okay.
And
Let's see.
that's under.
Oh, wait a minute, hold on. I need to do this first. I didn't do this.
Yeah.
I need to take off, maybe delete that one because we want to do, yes, and add prior to it. Wait a minute, I didn't highlight it.
Well, you're not adding a new one, you're actually editing what already exists. So go ahead and hit edit if you're trying to prioritize, and then
there
just
it was.
hit OK.
I hit add, yeah. I see it now.
There we go.
And then here we want to add
Under-
on this one, right? Under context.
Yep.
Glaucoma evaluation, doctor ordered.
Doctor ordered visual field.
How do you want me to do this? Type it out like that? Or DR, or does it matter?
Type that number. Doctor ordered VF and OCT.
Ah. Y'all quit watching me.
Today. Right.
Doctor ordered OCT nerve, or do the individual ones?
Doctor ordered OCT nerve.
Doctor ordered photo.
Doctor ordered photo.
I feel Jessica.
Oh, do you want it to say glaucoma evaluation?
Well, yeah.
Yeah,
We can edit it later if we need to.
because she said we can always edit them later.
Did you say you?
I thought you came up behind.
Doctor ordered.
You two stay. I mean,
Y'all can watch. Doctor ordered. Okay.
do you want me
You can see.
to? But here's my thing. If you only do doctor ordered, see, we would have to do each individual one. Actually, Morgan, remind me if I'm correct or not. If we select this, like doctor ordered OCT nerve, we can actually go in and add like and PACS today. We can manually type that in at the end of the sentence, right?
You can manually type.
Okay. So that way we don't have to do every single combination if we don't have to. Because it could be OCT nerve and PACS. It could be PACS. So let's just go ahead and add it.
Visual field PACS OCT.
Yep, there you go. PACS, visual field, and OCT. And then doctor ordered.
Doctor ordered IOP.
Photo value.
I got that one.
Okay.
Yeah.
Doctor ordered IOP.
Okay. All right.
All right.
Now, associated signs and symptoms, elevated intraocular pressure. Can we put on this one, or would it go here? Which one would we put it on? Like if the patient is compliant with meds or patient not compliant with meds?
Let's see.
Would it go here?
I would say
Wouldn't we? Well, it's normally under context, but that's not here. So,
we are less context. So you added all that in.
oh, I see it.
Yeah.
Okay, so that may actually be over here.
we need to put someplace whether they're compliant or non-compliant.
Yeah, but I'm thinking
That would be under.
it's here.
Would that be under modifying factors? This is,
If I save this, but so it'll still throw you over to these screens. Let's see, save. See, here it is. Severity, quality, context, right here. Let's see if it has it.
we're working on each folder here.
Anything, because sometimes you can add them. I'm just wondering what it's going to put in front of these sentences whenever you click into these. Here, is it going to make any sense? Yeah, it says Tammy Foxfire presents with or for. It'll say glaucoma evaluation and doctor ordered OCT nerve today.
Someplace we need to put in whether it's
I think under context at the top it says compliant on medical therapy. And at the bottom
it's
it
right here.
says
Yep, you're
not
right.
on medical
Yeah,
therapy.
there it is. There it is, right
Okay.
there. Thank you, Ashley.
Sorry.
No, I'm glad
I
you
just
said that.
saw it.
Compliant on medical therapy, not compliant. There it is.
yeah.
So it's already there.
Good.
Yeah, I think it needs to stay under context. That's
All
what we've been doing.
Okay.
Well,
Do you want it to say that or did you want it to say something different?
oh, do right. The drops
This
are,
is starting.
Yeah.
place.
it usually says drops and this just says medical therapy. Okay, what else do you want to, so we did diabetic, we did glaucoma, plaque Cornell exam?
Well, we did need to do a glaucoma suspect. That's what
So this would be like for people that are POAG?
Mhm.
Do you want me,
That's why I said, do you want me to put right?
yeah, and then do glaucoma suspect evaluation?
Pull up, pull up,
Monitor glaucoma suspect, I see that now.
I'm going to step away for just a second while you guys are customizing, but I'll be right back.
That don't make sense.
This is all different.
Yeah,
This is something somebody else did.
that's why we need like a little thing to corral, so I can look at that screen.
I'll go print it out.
Thank you. Like the HPI screen. Thank you, Ashley.
Is there one, go down, is there one that just says glaucoma suspect?
Maybe, let's see. Because we're not out of order. We can make it though.
Let's make one call glaucoma suspect.
And then,
And then under context, we're going to put reasons why they're a glaucoma suspect. Okay, makes sense.
mhm.
Let's see. Okay. And, okay, now, yeah, just do
Okay.
that stuff. Under context, I think we need to put, yeah,
Okay.
family history. Family history. Okay, and then next one would be large CD. CD
cornea.
change. Short-term CDs. CD asymmetry.
That's all that right. It's two S's, right?
I think it is.
Is it two M's or two S's?
Just one in.
Okay, I had it spelled right there.
Let's see, it's family history, large CD, CD change, then for you. Elevated IOP,
Age.
age,
Hey. Damn, you put
let's add ethnic,
ethnicity.
ethnicity, it's misspelled,
Oh.
ETH, get rid of the E,
Mhm.
NI, CITY. It can be one cover
Okay.
a lot of things. Let's see, age, CD asymmetry, CD change, LDIP, Cornea, in sleep apnea, diabetes.
Or does that
No.
fall on thin cornea? Okay.
Let's see.
You want to go back over here to look at this to see what we should put here? Just to see what it says to get some ideas. Oh, we'll see, they've got that under here. Intolerance of medication therapy progress. Progressive. Yeah, where's Ashley? Did she print that off? No.
Under modifying factors, put no history of meds. Issues.
Should I put medication or surgery or just no medication?
Under modifying factors, previously treated for common no meds now.
Okay.
And, patient lost, so it'd be a good place to patient lost follow up or something like that. Like to see.
We'd have to play with it and see what it looks when we, would have to see. I don't know if it'd be there or if it'd be there. Like once we go in and we have to start select them, you want to see what it would look like? We can do that and see what it looks like. Let's see, glaucoma suspect. Okay, let's see, cancel, glaucoma suspect. Should be here. Glaucoma suspect.
Now we need to, under glaucoma suspect, we need to put in doctor ordered. Where we put that before? Glaucoma suspect. And then
Under context. It was all here.
was it?
So this, maybe this should be here.
Well, those aren't symptoms.
No, where is?
Let's do. Let's see.
Did you get it?
That's a screenshot of every screen, and then that's
Oh, you're super
Mr. Browning
awesome.
that has POAG.
Oh, awesome. That helps. Thank you, Ashley. I was like, where is she?
Anything I can help with?
We actually, Ashley was helping us. We're trying to figure out exactly where to put some of these things to get some ideas.
Okay.
Suspect. But that'll be the same kind of thing. So you got
Yeah.
the location, which would follow under them other things.
Yeah. Let's see. Let me just look real quick. Pull it down.
Oh, yeah.
Location. Timing, okay. We need to add in. I'll put it under modifying. What should we put when we order the test? We have those under context before.
Because it normally falls under the
Chief
chief complaint, which would be,
Which is
it would be, I think if we do it under quality is where, oh, we might have those other ones in the wrong
I would
place.
say.
You may have to like add.
But see right here under glaucoma, under this one, we have it here. We're wondering if it actually should be here. Let's see, hold on a minute, I'm gonna close this. Glaucoma, let's do this. And so we can see glaucoma
By
evaluation.
looking at that one, under quality, the OU doctor ordered
Suspect.
visual field OCT today. Under quality and
I
so
think it's
in the
gonna
chief
let us,
complaint.
because I want to see what it looks like on the sentence.
And then what we'll do is just let me know when you guys are ready to like kind of have a good idea and ready to move on. So you can we can do it now, or we can kind of go through everything and then do homework with it. I'll just leave it up to you. I just want to make sure we get through everything today.
Yeah, it's trying to figure out where we got to put stuff. We have to really think about it, but I understand this part now.
Keep in mind, this is on my screen now.
I know, but see how it makes because we got to fix it. Yeah, this will be something. Oh, this is going to be fun. Okay, thank you. Yeah, we can move on to the next one because we got these screens, but this, it's worded a little bit different, shows up a little bit different.
Yeah.
We got to just figure out what goes where.
Perfect. So on the right-hand side, severity and timing are a single arrow drop-down. See that?
Yes.
Anytime that you have a single arrow drop-down, anywhere in the system, not only this screen, but everywhere, if you double-click in the field, it allows you to customize that drop-down. So it'll show you what's built there now, but you will be able to type in under New Item and hit Add Item. Like if you wanted to change moderate, you would just click in moderate, highlight, and change it, or highlight it, which is basically just that little black arrow next to it, and hit Delete Selected Item.
At the bottom. Okay.
Yep. So that is the customization for every single arrow drop-down. And that will not change across the board. Okay, so go ahead and close the door on this screen. On the next one, that's a double drop-down under Location. This is what we call a tree. The tree view here has a selection list on the left with a series of checkboxes, and then on the right, whatever you have selected will appear. To customize these screens, and again, every time you see a screen like this, and there's multiple of them throughout the system, what you would do is hit the Edit Tree button in the middle, underneath of the, so in the middle of the screen.
Oh, okay.
There you go. Now there's a number of different ways that this can happen. Go ahead and in the New Item / Child field, type in Test.
In which place?
In the field that says New Item / Child.
Okay,
So right up, so you hit Edit Tree, and then below there says Edit Highlighted Item. Below there says, okay, just type in the word Test. Anytime you add a new selection to a tree, you will always want to click Include in Letter Filter. Basically what that means is if you create a letter, do you want this to be part of your letter text? If you don't check that box, it's always going to ask you, do you want to include this new item in the letter filter? It just saves you that extra pop-up. Prioritize means you want tests to be above the non-priority line, just like we did before. And then you have the option to either add the item, which adds it as a standalone item, or let's say under the left eye, you wanted to add, lower left lid or upper left lid, you could actually add a child to that highlighted item, and it would just give you the little plus sign that you expand. For now, just go ahead and click Add Item. This then shows up in alphabetical order on the left-hand side. Go ahead and highlight, not click the check mark, but just highlight Test. Perfect. That highlights it in blue, and let's say that we wanted to capitalize it. On the right or in the middle, go ahead and click Edit Highlighted Item. This just brings up what you've already created and allows you to make changes. So if you wanted to prioritize it, if you wanted to capitalize it, whatever you wanted to do here.
Okay. And so expand, I guess, is to add things underneath it with a plus, I'm guessing.
Expand just simply means you want to expand it and just see what's underneath of it.
Oh, okay.
Yep, so I'll show you how to expand it manually. Then you can hit Update Item. Okay. So now let's say that we wanted to add an item underneath of test. So go ahead and put in test number 1 or test 1 or test 2 or just something in that field.
Do I leave test highlighted up there with the check mark?
Yep. And then we always do include in letter filter. And this time, instead of add item, click add child to highlighted item. There you go. So that's just what it will do, is it will expand and say, okay, test, and underneath of test you could be more specific and do test 2, test 3, test 4, whatever the case is. Does that make sense?
Yes.
Awesome. So in this case, let's go ahead and delete these items. So you have test highlighted, and the very bottom button says delete highlighted item.
Mm-hmm.
And it will say it will affect 2 items because you have the parent highlighted.
Mm-hmm.
It says click, okay, so did you
sorry.
to read that?
I read it. Yeah, I read it. I was like, are you sure?
So just so you know that you're deleting 1 and moving test 2 up.
I'm sorry, hold on a minute.
Okay. So if you hit delete, it tells you you have 2 options. You can click yes to move up the child item, or click no to delete all. So if you wanted to delete all, you would click no.
Delete all of the items, so yes.
Yep.
Okay.
And then when you're done, you just click the done button, which is above or right next to where the edit tree button was. Yep. And then you can hit close.
I hope somebody else is helping write notes, because me doing this and trying to write notes is a little difficult. So I really hope somebody else is writing notes down. Okay.
All right. So let's go ahead and go, we did severity, timing, location, duration. This is just a field that has a, basically selection items. You can either free type in here, select the buttons, or next to where there is 5 years, there's a drop down. So at the very top, there's a drop down selection. So that's just kind of a quick option as well.
Okay.
Okay, so go ahead and hit cancel here. That is the process of customizing the chief complaint screen. What questions do you have in here?
None on editing. We just got to figure out how it's going to word out. So
Okay.
Set them up.
Morgan, I have a question.
Certainly.
Okay, so I think where we're getting lagged up here is under the HPI letter text here at the bottom.
Okay.
Is that, I mean, I know sometimes whichever one you picked and a part of customization, it's not going to make sense. Does that really matter, or can you go back and edit it, like if we want to send a letter?
So the HPI letter text is what will automatically appear in your letters, but if you go down there, you can customize it. So like if you just click down there right now and try to edit something, you can.
Okay, so, okay.
You'll also be able to edit it in the letter itself if you want to wait and do it there. My suggestion is to edit it here so that if you send multiple letters, you aren't editing it multiple times.
Okay. Okay. So we don't get lagged in, you know, customizing so that it makes sense in the letter. We can customize in the letter later, like down there at the letter text.
Say that again.
Just so we don't get like too focused on editing in the chief complaint severity location so that it makes sense in the letter then. We can always go back and edit it later.
Yes.
In the letter text. Okay, I just wanted to make sure we could do it several different places so that we don't, you know. I hope somebody else knows what I'm trying to say.
I do. I know what you're saying.
Okay, well, I asked that question for you so that you don't get too stressed out about editing so that it makes sense in the letter, that we can always go back and edit it.
Yeah, you can free type all that if we need to.
You can take out words or add to, so.
Right. Right. It's just figuring out what goes under what place under quality, modifying factors and stuff like that for all of it to make sense.
Right.
Just because it's worded different in Crowd, we just got to, that's why I'm glad you did those screenshots for us, and so that'll give us some sit down and figure out what we need to do.
Okay.
Thank you.
All right. Any other questions in here? All right, let's go to the POH-PMH option. So the tab across the top.
Oh.
All right, so in here, the list of allergies, the list of medications, those items come from the SureScripts database. Do you guys remember where the update drug database?
Do I remember what?
Yep.
Expand that.
So
I mean, yes, I know that that's where we go to get it. What was your question?
I'm just as a kind of a refresher, and you'll hear me ask this quite a bit today. Do you remember where to go to update the drug database? Because there's no customization, it's just an update option.
I do not.
No.
Okay, go to the options drop down.
Let's see.
So options are across the top. Not in the exam itself, yep.
Yeah.
And then when you click options the first time, it allows you to expand it with a little double drop down at the very bottom, but there's the update drug database at the second to last. And then this is something that, remember, we talked about everybody has to be logged off. We wanted it to do probably end of month. It'll run overnight, and this is one of those pieces where you don't have to log out.
Yeah, it's written down on my other stuff.
Okay.
Okay. For ocular history, if you click that double drop down, which is going to be the same as medical surgeries and ocular surgeries, this is just the same tree that we had before.
Okay.
So you would hit edit tree, and you can add an item here.
Same way we did on the other tree.
Yes.
Okay.
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 Yep, you can go ahead and hit the close button. If you forget to hit done in the middle, that's totally fine. It's still going to save everything you do.
Oh, okay. If I get in the habit.
So
Just the same way every time you get in the habit.
Yep. So just below there, under the yellow boxes, is the family history option. So there's description relation. So if you click the drop down under description, you'll notice, nope, the drop down option. So click where it says none.
Okay.
Go ahead and click on it. And see how there's a drop down?
Yeah, I was clicking on that arrow, the other arrow.
And then this is just the single arrow drop down. So to customize this, we double click.
Oh, okay.
Remember, you double click in the field. There you go.
And then you can edit, add, remove.
Yep.
Anything like under family history, like we always do diabetes, glaucoma, or EyeMD.
Yep.
So we can add to or take away.
That looks good.
Okay.
It's like pointing right there.
Okay. I was showing Dr. Betzel.
No problem.
And then just close the door on this, right? Now, well, never mind. Never mind. I'll be jumping ahead. Okay. So it matters in their family history.
And then relation, go ahead and do that one too.
Okay. Pretty much everybody.
Okay.
So in here, depending on the level of specification that you do. Like most folks will just have grandparent or great-grandparent and remove the maternal and paternal, just as kind of a suggestion. When it was required for meaningful use, which it isn't anymore, it was just first degree. So a lot of times we just had parent, child, sibling. We removed aunt and uncle. Some people add cousin. It just kind of depends on what you're looking for in here. If you want to, you know, if you're going to get those ones where like I have a second aunt who you can always free type in these fields. So definitely add the ones that you use most often. And then for those kind of here and there ones, you can always just free type them.
If I want to delete one of these and just make them like great-grandparent and grandparent, remind me again how I do that right here. Can I just like take this out and then save it and then delete the other line?
Absolutely. So if you wanted to delete paternal grandparent, you just hit delete selected item at the bottom.
Delete selected item. Yes. And then click on this one. And this one, and we'll delete. Yes, delete. Now the code over here, the ICD-9 code, that doesn't matter because it still says maternal.
Right.
Does that matter?
The codes actually don't matter anymore because this isn't meaningful use required, so it's actually not tracked. MIPS doesn't require anything family history related, which is why I'm not worried about what the code or having SNOMED or any of that information is. So yeah, we aren't going to worry about that because it's not tracked for MIPS.
You'll just leave parent as parent, necessarily mother, father. Okay, and then just hit close the door.
And then go ahead and close the door. Yep.
Okay. All right.
That's all for customization in this screen. Any questions?
No.
Okay.
I think so.
Let's go ahead and move to ROS, or Review of Systems. This is your standard Review of Systems screen. You can't delete what's already here, but you can add 2 items in every field except eyes. You can add 4. So to show you how to do that, we're going to go to the Options drop down across the top. And you can either double click it or hit that drop down. Yep. And we're going to go to ROS Custom Defaults. So flashes and floaters I added in here kind of as an example, and I have that for each system that we do. But then you can just see that it has each section of systems, and then you can choose to add up to 2 items in each of the areas.
Oh, it flashes floaters because it already has. Yeah, I think we're good.
Let's look on CNT. Let's see, I don't see hypertension on the cardiovascular.
Hypertension's not on here anywhere that we're missing, is it? Because it should be under cardiovascular.
I can help you look.
Just want to make sure it's not stuck somewhere else that we don't see.
Nope, I also don't see it.
Okay. So I tapped it over here under Custom 1. Did you want anything else? Let's see. Endocrine.
Yeah, under endocrine.
Should be.
We should have diabetes.
I think that falls under, it falls under this.
It does?
Yes.
Okay.
Actually, I think that may fall underneath this too. Patient medical history right there.
Okay.
I'm going to look at something. I'll go back a screen. It falls under patient medical history. You can add it all right here.
Okay.
Yeah. Okay.
I got you.
All right. We're just, we're getting familiar with it. Okay.
Under the Vitals tab, there's no customization option there.
Okay.
So we're going to go under the Workup tab.
Okay.
So in here, you're going to see that there's a lot of single arrow drop-downs. Those are customized just as we've already learned with the double click in the field. Okay. Now, under AR, MR, and W, go ahead and hit like sphere under one of them. Yep. So in here, under access, let's say you wanted to add 001, 002, 003. If you double click in that field on any of the numbers,
Mm-hmm.
on any of the numbers though,
Sorry, apologies.
double click, yep, that will allow you the same customization field. So basically you would just go in and click your mouse before the number 1 and type in 00, go down to 2, 00, down to 3, 00. That customizes these refraction screens for everywhere. Auto refraction, wearing, manifest, R2, R3, and final. So you only have to customize them one time, and then when you go to the next one, you will see that it has been customized.
Okay, I have a question. If we want to change the axis under the manifest refraction, and we want it to be every 5, like 5, 10, 15, 20, 25, 30, we can do it this way.
Yep, you just customize here.
But
Okay.
it would change all the fields, like auto refraction and
Wearing. So if we changed it in one, it automatically changes it everywhere. Is that correct?
Yes.
Okay, so I have a...
leave it the way it is.
Leave it the way it is?
Yeah.
Okay. If we did that and changed it to every 5 axes, and we have the auto lensometer or auto refractor fed into the machine, would it automatically shift the axes, or would it put in exactly what it says if it says 12 and 58 on the reading?
It will put in exactly what it says.
Okay.
Okay.
So we could still do that here,
Okay.
and that would automatically feed in and be correctly.
Okay.
Okay.
All right.
Good. Thank you.
You're welcome. All right, so the areas of customization I would say we should concentrate on right now are IOP method and dilation agents.
Okay.
Sorry, I'm writing down. Okay. Dilate and IOP methods. Whoops, I always do that wrong.
Okay, so what we'll use is
Cool.
Goldman and iCare.
So I want to delete this.
Delete
So I
Pascal.
delete item. Yes. And Tonopin.
Yep.
Delete item. Yes. And close door, correct?
You got it.
Okay.
And
And then dilating agents. Here they are.
let's see, 1%.
0.5% is not on there. 1%.
Let's, I think we can eliminate number 1. 1% cyclone.
We don't use that.
Can we change the order of these, Morgan?
You can. So if you want to move them up or down, on the top right-hand side, there's a reorder by alpha, move selected item up, or move selected item down.
Okay. Yep. So we want pyramid. Then we want,
I vote alphabetical order.
say again?
But I
Well,
vote
what we use as far as what y'all use in workup all the time is pyramid, tropicamide 5%, 0.5, and tropicamide 0.1. 1%, right?
yeah. Yeah, that's
So we
true.
add. So add new item.
So first you'll type it in. Yep.
Right?
Yep.
Okay. Oops. That's going to be fun getting used to. Add, and then move up. Okay. Does that look good, Ashley, Jessica, Dr. Betzel?
Put cyclopentolate towards the bottom 1%.
This one. move down. Let's just put it at the very bottom. There's another one, but we don't ever use this one. So you want me to delete it? Or it's always 1%?
Delete 2%.
Delete. Did we use this? We don't use that, do we?
No.
Delete. We have that. We don't. We have this, but what's this right here? Delete. And I'm gonna put this one on the very bottom. Is that okay?
Mm-hmm.
Whoops. We got them down.
Okay.
Okay.
Yep.
So now just close the door because that's how we want it to look, correct? Yep.
Mm-hmm.
Close door. Okay.
Okay. Any questions for the workup screen for customizations in here?
Yeah.
Awesome. Let's go ahead then. We can move to the workup 2 screen. This is actually processed exactly the same way. The double drop downs, we'll talk about contacts here in a little while, but the single arrow drop downs are the double click, and then the double drop down arrows are a tree. So one of the things that we want to talk about is the wearing contacts. If you customize here, it also customizes your final contacts. So this is a tree that will need customization. This tree is not kept up by any type of a database. So there's items in here that are even no longer made anymore. So this is an area that you will have to go in and work on. My suggestion is the first thing to do is delete what does not belong.
Okay.
Then you can go in just like we did before, and you can edit the tree. And you have the ability to add items, edit items, or delete items.
Okay, I have a question because I know they don't make O2 optics anymore. So I highlighted it. Where would I delete it? I don't see delete.
Yep, remember we hit the edit tree button first.
Oh, okay. Edit tree.
And then there's
click.
the delete highlighted item button.
Okay.
Okay. Did you have any more questions on what we practiced in here, or want to do a couple more to make sure that you don't have any questions?
Do you see one?
Optimatory.
Whoops. Hold on. Let's see. Okay, wait a minute. You cannot.
So there's a difference between checking the box
Okay.
and just highlighting it. So right now it's blue and highlighted, so you don't need to check the box. And what it's telling you is it's telling you cannot add more than one contact lens because you already have one up at the top on the right-hand side. So if you're just trying to delete optometric, just hit delete highlighted item, because remember, checking the box and highlighting it in blue are two different things. Yep, there you go.
So did that delete it?
Yep, it's no longer on the list.
Okay. So now if I want to, the focus daily.
Don't click in the box.
Oops.
There you go.
Focus
Now
dailies.
delete highlighted.
Delete highlighted item.
Yep.
And then, yes.
And SIBA solves. All the SIBA solves. Delete.
Don't we have someone on this?
SIBA solved.
Okay. Okay, wait a minute. So
Delete.
delete. It's just the way I click on
SIBA
it.
solved. No, you check the box. It's already out.
Well, it automatically goes
Yeah.
over and highlights it. Okay, it's moving down.
Highlight. If
I
it's
see it's moving
highlighted,
down
it's
now.
ready to go.
Okay, I see it's moving down now.
So yeah, I think
That's what I was doing. Okay.
focus toward monthly highlight. Leave it. Oops, it's a check box.
I don't understand how it's doing that though.
Now hit delete highlight.
Okay.
Right. Just try to go over here on the edge and just try to highlight and give you advance for students. There you go.
But see,
It's okay.
So
It's
what
fine. You can, so just read the box. It says you cannot add more than one contact lens brand. If there is no other contact lens brands, please click the clear all button to reset. So if you hit OK here and just hit the clear all button on the right hand side, it'll take away that pop-up that keeps coming up. Highlighting it may check the box, and that's perfectly okay. It's not hurting anything to do it, but there is a clear all, so like the
Where's the clear?
on the far right-hand side. So there's add free text, edit, remove, clear all.
Ah,
There you go.
okay.
So basically it just resets it. And then what
Okay.
you'll do is when you select another one, it may go back into that box. So you just have to kind of decide, do you want to clear all each time, or do you mind just getting that little pop-up and hitting the enter button and moving through it?
I'll have to do edit tree.
Mhm.
And then delete. So all of these actually, right? Because we don't do any of those. Delete. And delete. That one, well, we may have one.
In that community.
Okay, we got it.
Okay. So
Now,
let's go ahead.
when you hit close.
Yep.
On that one, done with that? Okay.
All right. Otherwise, everything else in here is customized the exact same way.
Okay.
If there's anything you want to kind of click on and do, now is the time.
TBT.
I don't know. What does TVT stand for?
Tier volume test.
Okay.
Just as a reminder to everybody who remembers, if you don't know what an abbreviation stands for, how do you find out?
It's just the color test and that added to this.
Oh,
Yes.
yeah. That's true.
Yeah.
If we want to add like the color test and NPC to this screen, do we do it? Oh, were you about to get to that? Or?
We will get to that, but we're not there
Okay.
yet.
Okay.
So
The
just
workup text kind of reminded us of that. So.
Just a reminder too, and just to go back to my question, we asked what TVT meant. Who remembers how to find out what that means?
Go to options and help.
Actually, if
Or
you just
something like
hover
that.
over it, so put your mouse
okay.
over TVT and just let it drop down, it will tell you. So just a good reminder for everybody, because we do have different abbreviations than what some of us may be used to.
Okay.
Okay. Any other questions on workup 2? We will get to the customization portion at the bottom. That's when we get to visit types, which we aren't there quite yet.
Okay.
All right, so let's go ahead and move down to the doctor tab. The next thing we're going to do is customize our normals in slit lamp and fundus. To do that, you go to the options drop down. And you select exam normals. And here you just override any of the normals that you're looking for.
We'll have to see what it normally reads in the other one, because you have like peak, NNR. I think some of this actually broke out a little bit more. I think. Hold on. Actually did it.
Do you want to go ahead and take a few minutes to go ahead and do this now so we just get this part done?
Actually, she didn't screenshot that one. She didn't screenshot that one.
Let's go with that. If that meets coding standards, like if that meets the standards as far as coding standards, no abnormalities. So.
Light and quiet, clear.
Mm-hmm.
They say deep and quiet. Background, lens clear. Yeah.
Yeah.
We'll just leave it like that.
Let's leave it right there.
Very good. That was easy. Let's go into Lens RX. Actually, let's jump to fundus quick. I was thinking about, I was going to add those macular degeneration options for you, and then I thought this would actually be a really good opportunity to customize and train you how to customize, because we have to train in here anyway. Hit the Enter Findings button.
Okay.
Okay, so there's 2 things in here. This, as you can see, looks exactly like the chief complaint area if you hit the edit button at the bottom left. Okay? If you hit macula, it expands and you can have the ability to customize each of them. So
Okay.
under the condition, my suggestion, when I do it, I delete ARMD and then I add AMD wet and AMD dry and then I expand on them. If you want to delete that, you can. If you want to leave it and just add the other two in addition to it, that's fine too. It's entirely up to you. Once we add our selections, we have to tie the ICD-10 code to it. So that's what we're going to do next. So for now, you can delete that later if you want to. Let's go ahead and hit the Add button under Condition.
Okay.
And type in AMD wet.
Wet. No, just,
Or just wet?
just wet.
And hit OK. And do the same thing for dry. Okay.
Okay.
Now, what we're going to do is we're going to work on, it doesn't matter to me which one we work on first, but let's go ahead and select whether it's wet or dry.
Okay.
So under the AMD dry, when you select that one, we have intermediate, advanced with subfoveal involvement, advanced without, and early stage. So once we have that highlighted, we're going to go under the column that you have your mouse in, and we're going to hit Add. So in here, I would put advanced with subfoveal involvement. So I personally don't, because it won't show you everything, so I put like ADV W/SUB/INV. If you want to write it all out, you certainly can, but just know it's only going to show you what fits in that box. So a lot of
Give us
times,
your suggestions.
Okay.
Yeah.
Advance with, is this what you said?
yep, so I did ADV space W/space SUB space,
SUV?
yep, subfoveal,
Okay.
B as in boy,
Okay. Sorry.
and then
Mhm.
space INV, and then hit OK. So what this means is macular degeneration dry, advanced with subfoveal involvement. Now we have to tie a code to that. So highlight advanced with subfoveal involvement, and at the
Mhm.
bottom of that column, hit Suggest Diagnosis.
Okay.
Destination field will always be DFE, dilated fundus exam.
Does it matter if it's all caps or can
It
you click on it?
actually is just part of the drop-down. Yep. Then under Diagnosis, hit the double drop-down, and it'll bring you to the diagnosis tree.
Okay.
Go ahead under Filter and just type in MAC. So
And then
under
enter?
macular degeneration dry, hit the little plus expander,
Uh-huh.
and then find advanced with subfoveal involvement and hit next. Now every time you select macula, ARMD dry, advanced with subfoveal involvement, it has the specific ICD-10 code associated with that finding, and all you have to do is hit save. Yep.
Okay.
So now we would move to the next one, advanced without subfoveal involvement. Perfect, and hit OK.
And then without,
Mm-hmm.
and then
Suggest.
suggested diagnosis, and then this, and then this, and macular degeneration dry. Whoops, that one.
And you have to
With-
you'll have to
Oops.
uncheck the parent. There you go, and
Okay.
then check the without. Perfect. And then
Without.
next and save.
And then say, oh,
Then
okay.
we have early stage and intermediate stage that we're going to add after that.
Added on this in the same column under comments.
Yep, those are the 4 options for dry.
early stage.
There you go.
Next, and then save.
Yeah.
Oh, okay. Add. Yeah, it's just making sure we get them all in here. And the other one, is it severe?
It's
Isn't it?
No.
intermediate.
Intermediate.
Oh, severe is the wet. Okay, my mind just went blank. Is that right? Is that right?
Mhm.
Okay. Diagnosis. Back. And dry. Intermediate. And then next. And then save. Okay.
And then we
Right.
do wet. And I don't have severe under wet. I just have the active, inactive, and then inactive scar.
Oh, okay.
So what I would do is I would just click suggest diagnosis to show the tree, and I'll kind of show you what options. You have to select the one under. We're not going to actually add anything, but just to show you where the tree is, just hit the diagnosis drop down, and then search MAC.
And then do the wet.
And then look at what's under wet, and those are the options.
Okay, so that's what we need to add under.
So what I would do is I would jot those down and then go ahead and add all three of them. While you do that, I have to step away and take a phone call really quickly, but I will be right back. This will also allow you to add additional conditions, prioritize your conditions, just like we learned in Chief Complaint, and now you know how to tie the codes to it. So feel free to take a few minutes to do that, and then I'll be right back.
That's spelled right.
Neomass?
Oh, is it neovascular?
Yeah.
Oh, okay. I was thinking it was something else.
Yeah, I think we'll have without. Is that no? That's
Yeah, that's under wet.
okay. That's an E code. John Eames got it. Medical degeneration work. H codes.
You're right.
Let's add the ones we talked about below last.
And then
Without macular edema under
inactive
diabetes. That's definitely what we need to do is the diabetes.
scar. Okay. Close. Oops. Cancel that. Cancel that. And then go here. Add. Oops. Yeah. That's how that was. Okay. Click this. Suggest. That. Save. Whoops. I didn't finish it. DFE. And then his. Yep. Back. And then that. And then it's this one. And then next. And then save. And then add. Inactive. Yes. Okay, Matt, suggest DFE, Mac, Matt, this, and next, and save, and add. DFE, Mac, this, next, and save. And then save. Yay. Then you go back here to go back to it. So draw ARMD. So there's those. Okay, what they had under just ARMD is these. So we don't need atrophic anymore. because it's tied to one. It's tied to diagnosis code. I mean, I know we have to put dry and
Let's
wet,
leave
but
it down.
we can go back and add them. So we'll see where they are.
Okay.
What is BDR minus and BDR plus? There's nothing out here. And then you got this here.
That's the old terminology.
I don't see,
We're going to use NPDR.
it's not on here at all.
We're not going to use it. Remember a diabetic tree? There's NPDR on there.
Mm-mm.
Pull up that tree. We have the tree pulled out.
It's right here. Just swapped around here.
The top one. So, but not
See,
the,
that code was on something a while ago, but it was under wet ARMD. That's what you were pointing out.
so we,
That one in the right place. Wonder why that was there like that. Let's just get back over there and just, oh my God, edit. Just get back over to that screen. No, I don't know how to do that.
see, it's got mild, moderate, severe,
Mm-hmm.
with vacuum removal, without vacuum removal.
So then you get into the different
This
aisles
is for
too.
type 1.
You have to do right all up all both of those.
Let's ask how they're handling it.
Yeah.
And then we get into PDR. I'm simply going to start with a PDR vacuum removal, yes or no. I'm not,
And all the other stuff.
I'm-
This is way too expensive.
I'm not
To not be
going,
written about.
I'm not going there. So that's type 1.
Yeah.
Type 2s, we're going to have more type 2s.
Mhm. Which we use all those.
So we just need to ask about how we handle diabetes type 2. Yeah, that's good. I thought of something else too. When we go back to, we're looking at protest, NPC. I'm not talking about cover test. Oh, man. Good for her.
She said that on that cover test thing, she didn't know how to work that.
I don't know either. That's what I'm wondering if we can add it to them, but just this simple.
Simple.
Yeah.
And that screen. Yeah. Okay. Enrich. You don't ever tell me. Well, yeah. Sometimes you'll tell me that. So, like under hemorrhage, I was just looking macular hemorrhage. You'll tell. Sometimes you tell me that, but usually you tell me this, so I could click on this and then whatever here.
Yep.
Okay.
Let's put. Let's see. That's just. It's under macular.
Mhm.
You know, click on vessels. See what's under vessels.
Over here.
Okay.
VRBO, CRBO,
Okay.
dot block hemorrhages, goes vessels.
Good.
Hypertensive.
Yeah, periphery. Diabetes. I'm not going to let you do that. I'm not going to let you do that. Yeah, it's the only place anything about, it was at BDR and it was under macula and that was it. Okay.
Unless it's there, which I wouldn't think it was. Vitreous floaters, hemorrhages. We use persistent hallway. We do that sometimes.
Negative cells, positive cells.
I wonder if you can, I guess not, these are just in alphabetical order. I wonder if you can move them up to the top, but you can't do that.
Go to retina.
Retina. Spots. Region.
I'm just looking for anything.
Oh, here it is. No DR. Oh, it is no reflex. I don't know.
We'll ask.
Yeah. Yeah, because the only place it shows up is here, and it's this. That's it. It's the only place it is.
Background DR, that's the only term.
Yeah.
Now we use it.
In PDR.
PDR, PDR.
But it also needs to be put in here, right? Under both of these, because sometimes
Oh,
you'll
no,
say.
that's my question. Where do they?
I'm here if you have any questions.
We do.
Okay, sure. What can I help with?
Diabetes, Morgan. How do we handle diabetes type 1, diabetes type 2, MPDR, PDR?
We were looking through them under macula and retina and stuff. We didn't, or periphery, we didn't see it. The only thing we saw was a BDR, which is old.
You can just add them in there. So you can hit the add button and then put like MPDR. And then, so like the one I'm looking at here, and I wonder if I can send you a screenshot of what this looks like. Well, can you scroll down for me? Both of these clinics have the same thing in here, so.
Is it under macula or are you under,
I'm under macula right now.
Okay. Because we kind of scroll, was looking for NPDR or something and didn't see anything.
Okay, so they must have customized very similar. Oh, you know what? They did. They did this together at user group. So if you just hit the add button, like the clinic I'm looking at here has NPDR under condition, and then the first section has mild, moderate, severe, and the second one has with macular edema and without macular edema.
Oh, you can prioritize these under conditions.
Yeah, yep, and that's kind of what I mentioned before. Go ahead and prioritize like your top, so when you're in macula, what are the top 10 things you see? That way you aren't scrolling through a big long list. You're going through the most common ones there up at the top.
Yeah, I was going to ask you, can you customize these like you can under chief complaint and stuff like that?
Absolutely, yep.
Just NPDR and then add it from there.
Yep, and then highlight NPDR, and then on this, this one, so then under that first column, they added mild, moderate, and severe. And then in the following column, they did with macular edema and without macular edema. And then what they did is on the with and without macular edema, they did the ICD-10 codes.
Oh, but you have to select the mild, and you have to do it under each one, correct? If it's NPDR and you have mild with macular edema, that's one diagnosis code, and moderate with macular edema is another diagnosis code.
Well, you're going to remember the mild, moderate, severe, that's all part of the activation process in the assessment screen.
Okay.
So that's what's going to determine that particular code there.
Oh, which is where you also determine the I, correct?
Yes. Well,
Okay.
the I is going to automatically come over here because right now, like if you put it on OD or OS or OU, it'll come over, but you can also edit it or update it.
Okay, I got you. So suggested diagnosis. Yes. Oh, wait a minute. I'm in the wrong place. It's not macular retina. Look at all these things. This. Way, move that. Let me move that. Diabetes. Do you have type 1 and type 2? So type, well, you have to do it on both of them, right?
119, that's like with no complications. That's what, yeah, that's that's no complications. Okay. Oh, okay. Now, here we go. Let's see.
NPDR. It's NPDR without macular edema. This one.
With NPDR, okay, click on that. No, so no macular edema. Just click on it. Does that give us the diagnosis?
Mm-hmm. It should. You can't see it. Not letting me see it. Next. How can I see what diagnosis code it's actually attaching to it? Because I see all the words, but we can't see the numbers at the end. Wait a minute. Hold on a minute. Oh, no.
It's on, so when you're actually going to the tree, they're on the tree themselves. So hit save here. And then go ahead and just highlight it and hit suggest diagnosis again. And then hit the double drop down next to, oops, okay, well, that's okay.
Well, I'll do it again because I want to show you what we were looking at because we didn't see it.
Yep, so see to the right of it how there's all these little gray codes?
Mm-hmm.
That's the code.
But when you expand the type 2 diabetes mellitus and you, stop moving, and you see the diabetes, this one,
Mm-hmm.
you can't actually see.
Does it let you expand the window or scroll over?
I was, where did it go? I can't edit anything.
Okay.
I can't.
Hit edit tree.
Edit tree.
And then edit highlighted item.
So if we want this one, edit highlighted item.
And then the ICD-10 code is E11-3X9. And then the X is plugged in on the assessment screen.
X9.
Yep. That's the severity digit. So once you indicate your severity, it plugs in with the appropriate digit. So it's just a placeholder.
Where do we indicate severity?
We'll select it. This is tied to the diagnosis code without macular edema, and then this, when the X is for, it'll be for the mild, moderate, or severe. It's in the column right before that.
Okay.
Is that correct?
It's on the assessment screen. When you activate it and you have to do the severity and priority.
Okay.
Yep, that's where that X is just a placeholder so that you don't have a huge tree and, one for each and every single priority and severity. It just plugs in as a placeholder when you select it during the activation process.
Okay.
Yes. Next. Save. So we do it here, but then it asks us again later at the end.
Okay.
Okay, this is a lot. And then we would do the same thing with anything else that's diabetes related.
Hold on.
We would have to do the same thing with type 1. Okay. It's just a lot to remember on homework of stuff that we have to do. Oh, here, can you do that? Enter findings. And then that's what those look like.
How we found that one. There's no involvement. Type 2 without complications. E11.9.
It's not on here at all.
We saw it.
It was under macula wet AR&D.
It was someplace else. It was where's the diabetes stuff we were just looking at? It was in the tree.
But we have to build it here because it's not here. We have to build it under condition. Macula, no DR, the CDC, no DR.
What it would be type 2 DM without complication. Morgan, we're looking for E11.9 type 2 DM without complications.
Okay.
Is that already built in there?
I can take a look. 1 second. So I would go ahead and add it. I'm looking at a different database, but go ahead and add it in here. I can look in a couple other places to see if it's already built.
Where would you determine the difference, like when you're building it right here, when it's no diabetic retinopathy, the difference between type 1 and type 2?
I would do 2 different things. I would do a type 1, I would do a type 2.
And do it right here under condition?
Yep.
Look under retina. See if it's under retina.
There's no BDR, and that's it. Well, they're in alphabetical order.
Okay.
So there's nothing else on here to
It's
say.
under type. Okay. Periphery.
Make sure it's not there. No.
So, under retina, let's look at retina. That would be a good one here. Diabetes involves the whole retina. You know what I'm saying? What do you think? Oh, it'd be
However you want to do it.
Well, we need to agree on what makes sense about things.
Where's the sheets actually just put us?
A lot of times we indicate it.
Yeah, most of the time it's under macula, and then sometimes you're like, no, put it down here in periphery.
We'll do it under macula.
And then sometimes you're like, if it has, then you're telling me to put it under periphery. We can always go back and add those. Put it under macula,
Put it under macula.
and then edit,
So the
add.
you
No
want, you
DR.
want you want to list it just like this, because that's probably what that code's going to link to.
Yeah, either way, because we can still make it prioritize and make it up at the top.
Okay. Let's say type 2 DM. And it's going to be without complication.
Oh, I gotta add that. Put it under comments.
I don't know.
That's what I would do. I would put it, so then I would say,
Without
we have type
complication
2,
with
and then
comment.
here, I'm sorry, what?
What were you saying? Because we were thinking like type 2 diabetes without complications,
Yep.
without complications go under comments.
Yeah, to basically just say that type 2, and then here are the subcategories under type 2.
Like this?
Yep.
Okay, and then suggest, and then DFB. Macula. And then it's not there.
It's not there.
No, you have to put it under retina.
We need.
You don't
You want-
have to put it under retina. That's just where it falls in the diagnosis tree. Oops, hold on one second. I lost my screen here. There we go. So if you did you search macular degeneration? I would search
That's one that's here.
like I would search for diabetes, like DIA.
Like this?
And then, yeah, and then hit the contains check mark above it. And that basically just says everything
that has
with
it.
diabetes in it, yeah. So if you are doing like BDR-DM type 2, the third one down, expand it. And then it says without edema. Otherwise, if you delete DIA and under code filter type E11.9, it'll search all by that code as well.
Code. Where is that?
Right here.
Code filter.
Yep, code filter E11.9. And then it'll search, there's all the different codes for that.
Yeah, it's all under retina in this. If we put it under macula, but it's under the retina tree, does it matter? I think you said it didn't matter, correct?
Right. This is the retina. Okay, so the reason it's under what's called retina 3 here is because when we switched over on that October 1st day to have the specific ICD-10 codes, to make it easy, we had to build them under one tree. All of those specifics ended up under the retina 3 tree, so it doesn't matter where you actually put them in the findings. That's just is the tree that all of the updates went under. But don't worry about that.
Okay. E11.9, there it is. So next, and then save. Okay.
Right. And let's do the same thing.
For top one.
Top 1.
And, oops. Oh, I didn't have to do that, did I? Delete, because it'd be the same thing. So it's this one, and then this one. Because we want to do, what's
The
the,
code filter is
yeah,
E10.9.
E10.9. There it is. You cannot add more than one diagnosis. Oh, how do I delete this one?
And it says if there's no other diagnosis, please click the clear all button to reset.
Okay. So take it out of this one. Show this and then show all. Oops. E10.
No.
And then this one. Okay. And then save. Okay.
Okay. So the customization in this piece between the slit lamp and the fundus screens are exactly the same. It's basically just this same thing over and over. This is something that you can always customize on the fly and you can customize later. If you go through here and you're seeing a patient and you find that, okay, what you were looking for isn't there already, you can free type it, jot it down. I'd always have a notebook everywhere, but jot it down so that you know you need to customize it going forward. And then worst case scenario on the assessment screen, rather than clicking the box, I'll show you how you can manually select the diagnosis. So if it doesn't automatically tie to it, we do have a way that you can still diagnose the patient even if it's not automatically tied yet.
Okay.
Okay. Any questions on this portion? We'll kind of get through some of this section and then I'm going to give you about an hour to go through and just customize.
Okay.
Okay.
No, I think we're good.
Okay. So let's go ahead and save out of here.
Hero settings. What does that mean?
Just hit OK. Because we've done hit OK. We've done so much under that macula up at the top, it just was letting us know that it's too long to show in the screen. So that's okay. This is a test patient, so we aren't going to be too worried about it. Up at the top, there's a lens use drop down. This may be an area of customization for you. The lens use drop down, if you double click in the field, so above the enter findings button, it does have a list of lenses available. If you want to customize, let's say you use the 90D lens most of the time, like 9 times out of 10, you can have it automatically populate here. So if you double click to customize,
I normally use a 90-20.
So this one?
Yeah.
Okay.
Okay, so if we want it to be this one?
Well, you'll want to customize it first. So go ahead and pull up the customization window.
Which is where?
On a single arrow drop down, does anybody remember how to customize?
Double click it.
Double click, good. So in here, if you wanted to do that lens, you would move it up to the top. So right now it's a blank one at the top, but if you move selected items up, then it will autofill. I'm sorry.
It automatically defaults it?
Yep, it will automatically default it. And then if you have to change it, let's say one patient doesn't particularly fit that lens, you don't want to use it, all you have to do is just select from the drop down.
Okay, perfect.
Okay.
And then close door.
And then close the door.
So that explains why when you open some of these, they don't have a line above it because they're already set. Never mind. I'm not making sense when I say that, but I understand it. Okay. Like these under normals are automatic. For the normal, because there's not a line above it when you edit it. Okay.
You also have your cup to disc ratios here. These are single arrow drop downs, so you will just want to have time or spend some time going through each screen and making sure that those drop downs are customized to your liking. So just a reminder that that's there too. Otherwise, what we'll do is we will go to the Lens RX screen. Here, the customizations we already did on the workup screen as far as the contact lens options and the prescribed specs, which is the refraction options. But the piece that you may want to customize in here are the remarks. So under prescribed specs, under prescribed contacts, there's two drop downs, one that says RX spec remarks, the other that says RX CL remarks. If you want to add different package item options, this is just a drop-down list that you can create.
Okay. The different type of lenses we use.
And the information that you enter in here will print on the RX. It will
Okay.
also be sent over to the optical department.
Okay.
Okay. Any questions on that side?
Hold on a second, we're writing it down.
No problem.
Okay.
All right, so let's go ahead and jump to the assessment side. Now in here, as you can see, the options that you selected are all building in that bottom screen.
Mm-hmm.
If you want to, let's say you had a patient with a condition and it didn't show up here, but you have to diagnose them, the other double drop down here gives you that diagnosis tree that you've been working in. So, yep, hit the other double drop, that's the fast diagnosis one, the other double drop down. There you go. And that's the full list of diagnosis codes.
Okay.
Now, this works in a way that you can add diagnosis codes in here. There's the majority of the codes in here, but please know that this is not an all-inclusive list. If you've ever seen the ICD-10 book, there's too many to have in here. So we have a very good list of them, but you may come across some that are not in here. Please don't be surprised by that. If we built everything in here, first of all, it wouldn't be beneficial for all the clients that we have because not everybody uses all of them. Plus, it would very much slow the system down because of the amount of them. So these are easy to add. It's the same as the edit tree option that we've done before. You would hit edit tree, and I'm just going to show you how to add kind of a fake one that we'll delete. So I want you to add a new item, test. Under the diagnosis suggestion, you can click that drop down just to see what's in it, but you are actually not going to use these options. For example, I have these options built in, like for the minus sphere and MRARW, myopia is attached to that. That way when you put in a minus in one of those fields, it's automatically triggering myopia. It's triggering astigmatism, presbyopia, hyperopia, those things. So unless you're doing refractive codes, you won't use the diagnosis suggestion drop-down box. So then go ahead and include in letter filter, and I'm also going to have you prioritize it so that we don't lose it.
Okay.
Now, here, underneath of that, there's SNOMED, ICD-9, and 10, along with a modifier. If you know the ICD-10 code, go ahead and type it in here, and then you could add it. However, if you don't know it or there's specific ones you want to search and attach the SNOMED and so on, that's where the coding resolver comes in. So right now we have test written up there. So a coding resolver is going to try to find an ICD-10 code based on the word test. But if you wanted to put in there, and go ahead and just put in myopia just to give you an idea, or put in an item and then hit coding resolver.
That right here?
Yep. And then hit coding resolver. And what this does is this system has every single code. It's just not in the front end. They're all built in this coding resolver. So what you would do is you'd be able to see here are the list of different myopias that the system found. And basically you would just highlight it. So if you wanted to do myopia right eye, which we don't specify this way because we specify it very differently, but you would do the H52.13 for bilateral or whatever it is you want to use, and it would autofill the information at the top. So you could select which SNOMED, which ICD-10, and hit save, and it will add that code to the tree for you.
Okay.
So although our system doesn't have, like right now we have myopia built in there, but it adds the specific codes based on the location that you enter in the assessment screen.
Okay.
Okay, so if you ever run across that, which you very much may, depending on how much medical you do, I've had clinics who have never had to add anything in here, and I very recently had a clinic who went, oh my gosh, we're missing, 4 or 5 of these. It just depends on what codes you guys use. Every clinic is different. If it comes to that and you have questions, don't hesitate to reach out to me. I'm very happy to help with that. So,
He wants me to try something.
sure, no problem.
What would be eye pain or ocular pain? There you go.
Pain in it?
Awesome.
Love it.
Okay.
I don't have to do Google. I can do it here. This is my Google. Okay.
Any questions for me on that portion there? And of course, like I said, please don't hesitate to reach out if something does come up down the line.
I'm sure you'll be hearing from me at some point.
No problem. Let's go ahead and close out this one. The next pieces that we're going through are some additional items for customization. So I'm going to just ask real quick, do you guys need a brain break before, because these other pieces are pretty involved?
Yes.
That would be yes.
Okay, let's go ahead and take a brain break. Let's come back in 15 minutes. So at 10:15, if we want to just resume, we'll go on with the rest of customizations. We'll take probably be about 30 or 45 minutes there, and then we move on to imaging.
Okay.
All right, I'll see you in 15 minutes.
All right.
Let's say start.
Is everybody back yet?
Not yet.
No problem. That's totally fine.
Okay. Oh, she's ready.
That's your face.
Oh, bless you.
Like a foggy cup. You know, not like an outside.
Morgan, are you there?
I'm here.
It's Tammy. I have a question for everybody in the office.
Okay.
At what point does everything that we do in Corral no longer transfer over to this when y'all start the conversion? What day?
That is going to be, we extract the data Monday night, so everything beginning Tuesday morning.
So any appointments, anything we do on any chart, we have to keep a log of.
Yes.
Lord. So how will it work on that Tuesday? Because we're actually seeing patients on that Tuesday, and you may have told Cindy, but how does that work as far as those appointments that we see?
You just keep track of them. So I would make sure everybody has a notebook, and every time that you change an address, add a phone number, update something to make sure that you keep track of it so that it can be added, update an appointment, reschedule.
Okay.
It's kind
What
of,
about the complete exams?
that's up to you. You can have a list, like print out your clinical summaries and then put them into the system like on Friday as practice.
Okay.
That's what most clinics do, is use it as a practice opportunity.
Oh, which is what I would be doing on Sunday because I'm going on vacation
Okay.
that week. Okay. He's not back yet. It'll be just a second.
Nope, that's fine. I do have something that we can, it's not training related, but I do have a piece that we need to look at for conversion. I've been asked by my development team to cross-check a few exams, so I'm hoping that if I provide you with a patient's name or ID and date of service, that you could fax me over the clinical summaries for those patients.
Of what's in Corral at current?
Yes.
Okay. Who's the patients or the patient numbers?
Yep, give me 1 second to pull it up. I have a few of them that I need to look at. So
Okay.
I just got to pull them at random because there's not a list anybody gave me, but
Okay.
let's go ahead. Patient ID 209436.
Okay.
I'm going to write these down. 436.
Yeah,
Date of service 10/3/13.
10/3/13. Okay.
And then let me pull up some B's. Let's do patient ID 213524. Date of service 6/15/15.
Okay.
Let's do patient ID 212464. I only have one date of service, 8/13/13.
Okay.
Let's do patient ID 204715. Date of service 12/12/16.
Okay.
And I'll do one more. And then once I cross-check them, then I give them to you for you guys to cross-check.
Okay.
So let me grab one more. Trying to find a newer one. Those are old. Here we go. These are pretty empty. Let's do 203115. Date of service 6/27/16.
Okay.
And then if you don't mind, just if you want to print them out and fax them over, you can't email them because we'll break HIPAA, but unless you have a secure way. But if you want to get those over to me and take a few minutes to do that, that will be hugely helpful because then we can just keep moving forward with that conversion.
What is your fax number you want me to send?
Sure, it's 605 977 1245.
Okay. Okay, hold on a second.
And then that is actually going to come directly to me, so you don't have to make it attention to anyone. So 3 scanners.
I'm gonna get Ashley to print this off and fax them.
Sure.
What we'll do when we're editing, like Ashley and I were talking about, the slip in the front screens, have this, you can split this screen and have no formats over here.
Oh.
And kind of, we were doing that yesterday with doing coding.
Oh.
And we can kind of see what's over here and what we're used to doing and how it's usually worded to fix over here. And fix the priority that we use all the time. Because I know where my dots are. Like PVD, we'll put it at the top. So content range, we'll put it at the top. So.
Yes. Right.
How many did you tell me? I mean, is there, you may have said this, is there a limit like under, on the slit lamp and the fundus on how many you can prioritize?
No, there's not.
Okay, awesome. Thank you. Okay, you wasn't in here. I asked at what point does anything that once it's put in crowd no longer will convert over. Anything after we close on Monday night will not convert. We have to manually.
Tuesdays, what that means is Tuesday.
Anything, appointments, office visits, exams, triages, anything.
Okay. And does everybody understand why it happens that way?
Yes.
Okay.
I just wanted to know the exact cutoff date.
Yep. It'll be extracted Monday night, and they usually start around 7 p.m.
Okay, because we close at 6, so that's fine.
Okay, sounds good. All right, are we ready to go forward with customization of some of the other parts of the system?
Mm-hmm.
All right, so let me switch gears here. The next thing that we're going to customize is our FAST plans. So as kind of we discussed before, FAST plans are a really, really big area of the system that we want to spend most of our time customizing on the front end so that by the time you get into the exam, it's literally just boom, 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 and you're done. So the customization that you'll be doing through here definitely takes time. However, the system is set up with a pretty good outline of FAST plans along with what we call a share cloud of FAST plans. So you're not left with absolutely nothing. You don't have to get everything done before go live, but it's certainly stuff you want to spend time on. So there's a few different ways to customize, and I'm going to show you the easiest way to customize first. The best thing I would do is I would start a test exam and I would diagnose that patient with your top 10 diagnosis. So I'm going to show you how to do that basically with what we kind of have already on the screen here. And then as you go forward for homework, I would go through and I would customize them based on your most common diagnosis codes. So if down at the bottom left, if you could actually uncheck each of those items to deselect them.
Okay. Oops. Right here.
Oh, it's under build. Oh, that's right, because we changed the date of service on this. That's okay. That's all right. Just never mind. Hit okay. I forgot that we didn't create this exam from scratch.
Do I need to go to a different one?
Nope, you won't be able to. No, and that's okay. I forgot we didn't create this exam today. We changed the date of service. So ultimately, when you create a new exam and you have your list of top 10 diagnosis codes here, I would just start, at the top and work your way down. So I would, and I'm a very opposite person. I do things right to left and bottom to top. In this case, I think we should start from the bottom because astigmatism and myopia are super easy. So I would go ahead and select astigmatism. When you select astigmatism, here's your severity and priority, which for practice purposes, I'm going to have you go ahead and complete.
So we never really have to do that before, so I just did mine. Or indeterminate.
Well,
Really matter.
let's go with mild first.
Okay.
And then priority.
Go along with it.
Okay.
All right. So once you get through that, here's your list of FAST plans. So this system already has 2 FAST plans specific to astigmatism that we learned about last week when we did training.
Mm-hmm.
Your goal here is for each of your most common diagnosis, and then you can also always expand after that, is to have your top 1, 2, 5 treatment plans pre-built. So for astigmatism, you have an astigmatism plan and one called refractive error. So let's go ahead and click on astigmatism. So in this, what we talked about when we trained was for this patient, if I wanted to put more in here than just monitor, I could just free type it in there. And how you know that you are changing just this patient is that in pink at the top right, it says changes will not affect the template. However, when we are customizing these FAST plans and going through to make sure that we have the templates customized, we want to click the Edit FAST Plan button. So please go ahead and hit Edit FAST Plan. This opens up the template. Go ahead and click it so that it catches the clicks. It opens up the FAST plan and it says changes will be saved to the template, which means every change that you make when you're in this edit mode will then be saved to the template, so every single patient will see these options. So the things that you're definitely going to want to do is on the left, FAST plan name. Right now this is just astigmatism. You may have, and I'm going to use, myopia is kind of a better one to use, so you may have myopia no RX, myopia RX, myopia LASIK. Those are the 3 ways that you treat myopia. You may have astigmatism no RX, astigmatism RX, and then just change the plan and discussion based on what the type of plan is. Does that make sense?
It does.
Okay. Now, when you're in this edit mode, I would always work from top to bottom. Does the plan name look good? If yes, great. If not, go ahead and edit it. All providers, you guys only have one provider, so that doesn't really apply to you, so you'll just leave it as all providers. To the right, patient education. I will very strongly encourage you to make sure every single FAST plan has education. I wouldn't supply that education to a patient because it's from like 2011, but in order to meet MIPS, the system must recognize system identified patient education. As long as it is tied to the FAST plan, you meet that measure. So if you click that patient education drop-down, it already has one tied to this particular FAST plan. I had tied a few of these. But if you click the drop-down there, there's a list of different education topics. Just tie the best one that you can find and try to do this on as many as you possibly can.
Okay.
Okay.
Now this one already has refractive error, and so of course that education would go toward astigmatism, myopia, hyperopia, presbyopia.
Okay.
If this version or this plan of astigmatism required medication, there's the eye and systemic medication boxes there with the double drop down on the upper right hand side of each one. You can tie in a medication with a SIG and its refills, what you're dispensing, all here.
Okay.
Then you have your plan and discussion below that. Remember that pick lock is a token. So that means when you select this astigmatism plan, the system's going to ask you to pick the location. So if you have a plan that you want to add a pick lock to, just type in pick lock exactly as you see it in uppercase. If you don't want pick lock because it just needs to say astigmatism, you can take it out. And I very strongly encourage you to use more than just the word monitor. So this one I would personally change, and I would make it a full sentence to say no changes with RX at this time, advise patient to return to office in 1 year for follow-up exam, or something along those lines to stay away from the word monitor.
Okay.
So you're welcome to do that now. Otherwise, under patient instructions, we kind of talked about suggest surgery procedure we won't use. Other actions we will use for like our foreign body removals and our punctal plugs, epilation, things like that. In patient instructions, this is just if you want to provide the patient with instructions for this condition. So for example, if my astigmatism was bad enough to get an RX, I could put get new glasses RX, or, you know, fill new glasses prescription, whatever the case is. And then if astigmatism required a follow-up order, now of course astigmatism isn't going to, but you're going to have like your glaucomas and your follow-up items that are medical that require images 3 months, 6 months, 9 months down the road. You're going to require a 3-week follow-up, a 6-week follow-up, whatever the case is. Come back next week for your follow-up post-ops. That's where you're going to add the staff orders at the bottom. Please do not add 1 year complete exam in here, because you may have astigmatism, myopia, you know, glaucoma, and a number of other things. You don't need 10 follow-up in 1 year. Those are ones I encourage you to just do manually on the plan tab. But the others that tie directly to that particular diagnosis, I would say, rather than adding, if you know that this astigmatism treatment plan is to have the patient follow up in 3, 6, and 9 months, I would add it here so you aren't doing that manually every time you treat this patient. Okay. What questions do you have on the edit version of this?
Let's see. Can we do one with a medical diagnosis like glaucoma? I think it's going to make
Yeah, we're
more
going to
sense.
go through a number of them. So here, let's go ahead and finish edits. You always do have to click finish edits in order to save what you did, and that's the same as the edit fast plan button. Yep. So now that's saved, and then you can just close the door here.
We put astigmatism, hyperopia, whatever. What was that last thing you said, Morgan?
Go ahead and close the door.
Close the door.
So let's go ahead and select one of your medical diagnoses there. And if you want to do one that isn't on that list, go ahead and select it from the diagnosis tree, which is the other double drop down.
Diagnosis tree.
Yep.
This
Yeah. And then you can either search by filter by typing in the name, search alphabetically, or use the code filter.
It's glaucoma.
I'm thinking. Yeah, I know what it is. H.H25.023. Well, that is, oh, it's not capitalized, I guess.
So this one, it may have an X in it somewhere for ours. So I would just put H25 and just see if it filters something from there. There
Yeah.
you go. The reason is because sometimes we have those codes or we don't have the last digits because we punch those in as the placeholders at the end.
23 maybe is glaucoma. I'm trying to remember off the top of my head which one is glaucoma.
Go ahead under filter and just type in GLAUC, G-L-A-U-C, and then hit the contains button.
Oh, contains.
So glaucoma looks like it's under H40.
It's the 40 code.
Yep, and then you can expand it and kind of take a look at some of the options.
Scope,
Where is the... Because we have to do mild, moderate, severe, right eye, left eye.
But remember, none of that is done here. That's all on the assessment screen when you do your severity and your priority, and then you indicate location based on where you enter it in the exam. And those codes are added to the back end as those placeholders. So we aren't going to have a list of acute or primary open-angle glaucoma with every single severity in every single location. We're going to have the main code, and then you specify severity, priority, and location when you assign the code to that patient.
this is primary open-angle. Click on that. See what happens. COAG.
Yep. And then here's where you'll do your location. So you can select the first location if it's in both eyes. So I would do OD. And then OS for location number 2. So I wouldn't give it to him twice in the right eye. There you go. And then you can do your severity for each eye. And then your priority.
Chronic.
Now here is all of the different FAST plans for that particular base diagnosis. So you can click through a number of them to take a look. Another thing I just want to share with you is that at the very top left, there's a check mark that says View Share Cloud FAST Plans. This will open up an additional list of possible FAST plans that you could use specific to that diagnosis that other providers using this EMR have shared onto the Share Cloud that allow you to download them and use them on your own. So you'll find this if you guys choose to come to the user group. There's usually a little meeting that some of the doctors get together and they talk about how they treat different conditions. We did this a lot last year, and one of our doctors, you'll probably hear more about him, but Dr. McPeak is out of Kansas. He does a lot of customizations, and he would say, here's what I customized, and then a number of people liked it last year, so he put it on the Share Cloud, and about 10 other doctors grabbed it and used it for their own because he did the customizations already for it. So this is just an extensive list of number of different ways that other providers treat this condition.
Say you do a basic FAST plan, but you can edit it on each patient if you need to, or no? If you use a FAST plan, you can't edit it?
Nope, you can edit it. So we talked about how you select your template, which is the base information on that FAST plan. And then if that patient has more specific, like personalized care that you need to do, that's where you either free type it in here where it says changes will not affect the template, or on the plan tab, you can free type it there.
Pick POHs out. I'll see the generic. Use the town price probably more, but I don't see the town prices.
Glaucoma. No.
Same medication.
But you could click, if we wanted to use this one, but instead of xylitane, have it latanoprost, can I click this and then edit the medication, or no?
That's where that Edit Fast Plan button comes into play. So you find the one you want to edit, and you hit Edit Fast Plan. Make sure you hit Edit Fast Plan, though. It has to actually, like right now you're still in the pink. There you go. And now it says changes will be saved to the template. Do you see that? And it got changed to Finish Edits.
Yes.
And then you can also prioritize these as well. So if you get to, this primary open-angle glaucoma and you don't want to go through this huge list of whatever there is, 20 or 30 different ones, you can click that prioritize check mark and then yours will show up at the top.
Where's the prioritize check mark? Oh, I see it. Okay.
Okay, put in parentheses, LAP. And let's see, we're going to have to edit it. We're going to say Latana
Well, I got to
Price.
do this. Patient education.
Okay, yep. So,
Glaucoma.
Yep.
Okay. And then here. Oh, wait a
Right
minute.
now,
Being able to prioritize.
I want to just
Oh, wait.
stop you because you're in edit fast plan. You're not in edit mode. You're just customizing for this patient specifically. So hit edit fast plan.
Okay, I got
And now, so now you can go through and make your changes and don't hit finish edits until you're completely done customizing this fast plan. I would hate for you to go through all that customization just to find out that you did it for one patient and didn't change the template.
okay, so how do we change the part under eye medication?
The same way that you add it, so click the double drop down. And
And
then
if I want to do this priority, can I click it on? If I do it right here under this part, this will be from now on. This is what we'll be able to use for all of them.
yes,
If we want to use them, so I can do
this
this.
is changing the template. Yep.
Okay.
So now remember on the left is your search, on the right is what's already selected.
We want to delete that.
Um,
Well, yeah, we're not using Xylitane, we're using Latanic
Okay,
Frost. So over here, we want to search for Latanic Frost.
okay.
Am I doing this right? Okay, there we are. There we are.
Yep.
Latanic Frost. And do I need to do add to lists right here?
Nope,
And
in
then do-
the middle you'll do your SIG, dispense, unit, refill. You'll do all of that there.
So one drop. QHS. Yeah. Dispense 90 days.
Mhm. Refills one. Nothing else you would usually do. Okay. And then you type pick lock to select SIG location. Where is pick lock?
You have
Because
to,
see, that's what I was about to say. What if we didn't want it to be?
so instead
Everybody.
of OU, I would type in pick lock so that you can indicate the SIG location when you add the fast plan.
So one drop and then type out pick lock. Is that right?
Yep.
Okay.
And
And
then
then
so that's just going to say one drop in whatever eye. Did you want to put at bedtime, at night, in the morning,
oh yes.
twice a day? Make sure that you finish that out.
One drop HS.
Yeah. Whoops. HS. Oh, actually, you normally have me do it this way. One drop HS, and then that'll tell you right, I left out OU. Is that right? One
Yep.
drop HS, and then whichever eye.
Yes,
And then add med.
correct. Go ahead and click add med. Yep, and sometimes it looks like we're clicking, but it's not. Yep. And then just
Okay.
always verify it's on the right-hand side.
It's over here. So now I can hit next.
Yep.
Or close.
Either one is fine. So
Yes.
that has now changed that fast plan so that you have that medication instead.
Okay.
Okay.
BOAG, and we'll tell you where. Now, does on the fast plans or on the treatment plan, because on the POAG, I know we have to do the mild, moderate, severe. I know that comes under diagnosis code, but don't you have to have it under the treatment code, a treatment plan too, or no?
Ask the question again.
Like right here it says POAG,
Yep.
and it'll say or whatever.
Yep.
We need a severity.
That's all built into the coding itself. That doesn't have to be on the treatment plan. No.
Okay. Because we currently document it on the treatment plan. So if we wanted to put it on the treatment plan on each patient, we'd have to actually
You'd have to type it in there. Yep.
manually type it on every patient. Okay. Okay.
Just a generic POAG. Then you wanted to go in there and add, like you always use when you have add them all to
not going to use.
medicine will not use.
Okay,
You'll have 10
different glaucomas.
different ones that have different medicine.
Okay,
Because the treatment plan's going to be the same. Take your medicine.
yeah,
You're
recurring
doing
for
the same
testing.
thing. Just the medicine will be the only thing that's different.
Okay.
Okay, you're going to be here helping us do that. I'm now
Yes, but
bringing
I
you in
was
to help
just-
the students.
I was just.
We have the girl that does workup has worked on a program that's similar to this one, so she was giving us suggestions. So I like that idea.
You could just go in there and just hit delete.
Yeah, we don't want
Okay,
this
we're gonna
medication.
We're going to do Afghan on this patient. So we're going to delete Livigan.
Okay. 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 Now, you know how you put target IOP and stuff on there? We would have to manually type that in under every patient, I'm
Or
guessing.
you can put target
IOP and then have the space and then you can add
and
it.
you could just type it really quick.
So like right here, underneath that, you can put treatment with drops. And then,
Instead of monitor, you don't want monitor in there, do you?
nope. Oops. Target IOP, and then we'll add it. And then instead of the word monitor, like right here, what would we put, Morgan? What's a suggestion?
I would put more of a sentence form, so I would put something like, you know,
Medication almost directed, or
you can do
almost-
that. Monitor usually just means will review or will follow up with condition at next full exam or something like that. It basically just means you're just going to continue to watch this at the next exam.
and he walked away because he was starting to cough, so he had to walk away for a second.
That's okay.
Saying that you need to come back to your next appointment and use medication.
Well, treatment with eye drops, so I don't know if this would work.
Next. Welcome.
Well, there's Dr. Bissell. Let's ask him. Dr. Bissell, instead of monitor, we added this, but then we would manually enter it every time. But then instead of monitor, would you want something like that or pulling it out of the air? Not really
Use
sure.
medications as directed. Yeah, I like that.
Okay.
Yep.
Next visit or follow up as directed? Would that be better or just follow up next visit?
Follow up as scheduled.
Okay. All right. Discuss with patients. Okay, Morgan. Then we do discuss with patient, progression. And opening.
Discuss with patient, I wouldn't worry too much about. You can
Okay.
certainly update it. That does not go anywhere on the patient's medical chart. That's in the background for legality purposes only.
Okay, okay. I remember her saying that now. Suggested surgery procedures, other actions. What would really go under other actions? I know you probably told me that, but
That's okay. Remember, those are going to be your procedures. So we don't do actual surgeries. We don't want to bill
Okay.
out a cataract surgery, but if you do like a foreign body removal, a punctal plug, epilation, those are considered minor procedures, and usually other actions has that information in it.
okay.
What do patient instructions do?
Patient
That's what
instructions.
clinic also would give to the patient, isn't it?
Yep, that is when you click that patient instructions button on the plan tab, whatever is there prints out for the patient. That's what the patient would see.
Instead of you handwriting,
Yep.
you know, here, I
Okay.
want you to do this, it would be
Okay,
here.
good.
Okay. And then when they call back, it saves it somewhere. If they call by the next day and I lost it, they can find it in their documents.
Yep,
I remember
they
that.
can. Yes.
Do we need to put in all as scheduled?
Well, it's,
I already got that there.
it's under plan.
Okay.
and then their next visit would print out on something, I don't know, I guess the receipt. Does their next appointment scheduled, I mean, you may have already told us this, or we may not have got there yet. Does their next appointment, will it print on the bottom of the receipt, or how does that work?
It doesn't automatically print on the bottom of the receipt. Their next appointment, most commonly, I see it on like a card that we give the patient. You have the ability to free type the information on the bottom of something if you want to, but otherwise,
Can you have the option of having it actually print on the bottom of the receipt, or no?
you'd have to free type it at the bottom of the receipt.
Oh, okay. Yeah. Mm-hmm. Yep. Or they free type it or whatever. Okay, now what point, where do you put when they're going to return? I think that was maybe in another part. That was an exam part, I guess, wasn't it?
That's in the staff orders. So that is where you click the add button here at the bottom. And then the only thing I would say, again, don't do is the 1 year full exam, but like if this one they need to come back for a follow-up or an imaging study, a test, or any other thing, if you're going to refer them to a particular referring provider, you want them to schedule surgery, whatever the case is, you just indicate what they want to do. So you're going to say, okay, glaucoma follow-up, hit next.
Okay, and then right here, if we wanted to do tests,
You would do that separately. Yep.
but we would do that manually, like on each one, if like depending on the patient.
Yes. So you can build them as the template, as like the basic, and then you
But
could
the glaucoma
delete them if they don't apply to a patient, or add them if they're missing.
Because all that will vary between patient. So, okay.
You can do it
That's
at
what
the
we-
end.
That's what we pick.
Do you? Yes. Oops. Got us granted me to know. So right here is where we would manually do it, because you can't have you'd have 50,000 different ones. Okay.
Okay. So then when you're completed with this one, you're going to hit the Finish Edit button. And then that fast plan is done and you'd move to the next one. So this is the process of updating the pieces of the fast plans for those that are already created. There's another way that you will update this information. So if you actually go ahead and close the door here and move to the Plan tab, I will show you another list of fast plans. This is the easiest way. This is my suggestion. But go ahead and close here and then go to the Plan tab. On the right-hand side, there is a button called Add Fast Plan. This will provide you with every single fast plan that is in the system. It will also allow you to add a blank fast plan, copy a fast plan, and delete a fast plan. So again, when you customize from the assessment screen, you're customizing what's already built. If you want to add a blank fast plan, copy a selected fast plan, or delete a fast plan, you do so from this screen. So a lot of times what you can do is there's a filter search up at the top. You can type in the name of a condition to try to find if there's something built for it.
But the other way is the easiest way.
Yes, the other way is the way that I very strongly encourage you to do it, but there's going to be some you probably need to do from this way. If you say, I don't find any plans that match what I'm looking for, you may need to add a fast plan. So we can add a test fast plan just to show you. So up at the top, go ahead and type in test where it says name and hit add blank fast plan. So this screen should look familiar. It just has an extra option to the right. So you would put in the name of the fast plan, your medications, education, discussion, instructions, and staff orders. But on the right-hand side, you would need to add a list of ICD-10 and ICD-9 codes so that when you activate those codes, this fast plan pops up as a suggestion. That part right there is why I recommend to use what's already built in, so you don't have to try to find all the different codes that may affect it. I also like to point out that I still link ICD-9 codes in here because the system does a conversion where if I put in an ICD-9 code for glaucoma, it's automatically going to search for all the associated ICD-10 codes when suggesting this FAST plan, so I don't have to add 10 ICD-10 codes. I can only, I only add 1 or 2 ICD-9 codes. So that link option, I do not know if that's going away, but for right now, that's definitely something I take advantage of because it's a time saver. I'd rather punch in an ICD-9 code, translate it to 10 and be done, than type in 10 ICD-10 codes.
Right. Makes sense. I have a question on the FAST plan where we were editing. Instead of doing a separate FAST plan for all the different actual glaucoma drops that we use, can we do a generic glaucoma one like POAG and list all the medications but then edit the medication on each patient and delete the ones that we don't need?
That's certainly fine. Yep, there's no wrong way to do it. You completely, you update it however it best fits you.
Okay.
Yeah.
Yeah, that would definitely be easier. Oh, yeah. Okay, close. Yeah, we may have to stay away from that, but I understand what she's talking about, kind of, sort of. Okay. Okay. See, none of this scares you because you've seen a lot of this already. It terrifies me. So really, I mean, I know we do the assessment, but the assessment is all the FAST plans, correct?
The assessment is the most streamlined way to customize because it allows you to customize whatever diagnosis you have put on this test patient.
And then the plan is where we do...
The plan tab just allows you to search every single FAST plan that's in there. The reason that I don't do that is because, like, for example, myopia, the most common FAST plan used for myopia is called refractive error. So if I search myopia, it's not giving me that FAST plan because not all of them are named what the condition is. So that is why I do the assessment way, because I can see everything that's already tied to that particular diagnosis code.
I just found Target IOP. It's right there.
Yes, Target IOP is on the plan tab.
Okay.
So go back and let's look at refractive error and see what it is.
Look here and go to here because we want to do the FAST plan.
Yeah. Well, look.
Mild, chronic.
Open
refractive error.
Let's look at it.
Refractive error, and then it was section 1.
And the reason this is most commonly used is because rather than saying myopia in OU, dispense new glasses RX, the patient, like me, I have myopia and astigmatism. So you would only have to add this FAST plan once, and it covers both of my diagnosis codes. So I don't add it twice, I just add it once, and then I just activate myopia, and rather than... So I would activate myopia, add FAST plan to visit, activate astigmatism, but just close the door because I already added a FAST plan for astigmatism. So
and you do the same thing with presbyopia. You can use refractive area for presbyopia as well?
Absolutely, for all refractive options.
All of them. Okay, hyperopia. Okay. So
because if you look at it, it's just simply based on your refractive error, which could be any of them, you want to dispense a new glasses RX.
Okay. There's nothing under patient education.
Yep, so you'll want to customize that.
So to customize this for all of them, instead of just one patient, do I click Edit FAST Plan right here?
Edit FAST Plan, changes, save, so right now it just says changes will not affect the template. When you hit Edit FAST Plan, changes will be saved to the template.
Okay. Refractive errors. Okay, so
Yep.
that would be what
That's
we
right.
collect.
Yep.
Select or whatever, and then archives. And then at the end, like if they do contact lenses, can you edit patient, well, not patient instructions? Could it be like get new glasses with RX given and contact lenses? Can
Yeah,
you,
make two. Make a refractive error for glasses and make one with contacts.
Yeah,
with glasses?
You
Okay,
could do that. You know, I would say the things that you're finding that you free type the same thing over and over, create a
Uh-huh.
fast plan for it to avoid that extra time. Because if it's already built, all you have to do is say, okay, this is the fast plan I want, add fast plan to visit, and you're done. As opposed to, here's a fast plan I want, but I have to add these 2 sentences. So if
so
those,
I could do refractive error / contacts, and then I would just edit this part, right?
Yep.
Okay. So right here, I could hit finish edits, right? And that automatically saves it. And then if we want to do this one again, do edit fast plan, and then put / or.
so on this one, before you do this, you're changing the refractive error. You're not copying it. So you're going to replace it. So I wouldn't do it this way. What I would do is at the top above that, I would type in refractive error / contact and then hit copy selected fast plan so that you duplicate it, but you're creating another one. Otherwise, you're just going to override it.
Yeah, Jessica's sitting back here behind me going, don't do that.
Don't do that.
Before you even said it.
There you go. And then copy selected fast plan. And then see how now you have a refractive error and a refractive error contact lenses.
Give new glasses with RX given. Oh yeah, prioritize.
Yep, and
thank you.
I would always work from the top to the bottom. So do your education. Okay,
We'll do
edit.
that.
Do your education, make sure your medications are updated. Then, yeah, I wouldn't jump around. That, and again, you can do this however you choose to.
Well, I was thinking it would automatically copy all of it, but it doesn't automatically copy the prioritizers.
We didn't hit finish edits before we went through copy. So
okay.
that's just what happened to happen there. But that's okay. It's good. It's a good learning opportunity. So.
New glasses / contact lenses.
New glasses. Or and contact lenses and or.
Yeah.
But this is actually the patient instruction,
Oh,
so
those
they
bells.
wouldn't.
Contact lenses.
And I have to run to the restroom. I'll be right back. I'm sorry. Excuse me.
Let's see, refractive error, dispense new glasses, RX, new glasses and or contact lenses RX. This would be the treatment plan.
Yep.
Should it be glasses and or contact lenses given today or RX given today instead of get you glasses?
But also said dispense new glasses.
Get rid of get. Just put new glasses and contact lenses. We need to get in there.
It just doesn't sound professional.
Let's capitalize new.
New glasses and or contact lenses.
Given today, maybe RX given today.
Yeah, that with RX given. RX given today. Like that. Oh, not this. Yep. Contact lenses, RX given. New glasses and or contact lenses, RX given today. Refractive error, then it'll say whatever, pick lock. It doesn't need to say dispense new glasses because we're not actually dispensing them. RX written, that's what we do now. It's RX written. RX, X.
RX4.
Glasses and or contact lenses. written today. Right?
And then now you're going to have to go back and edit
The other one.
bracket out.
Okay, so that's done. So click here. Okay. And then close the door because we're done with this one. Oh, shoot a monkey. Go back to
So we'll probably take about, I say, 4 or 5 more minutes here because we still have to get to letters and visit types before we get to lunch. And then we'll take the lunch hour, and then we have 3 more sessions to get through this afternoon, but luckily those sessions are kind of quick, like odds and ends sessions. So we'll probably go from 1 to 2 customizing for homework, and then from 2 to 5 we're going to train through imaging, some just odds and ends pieces that we'll probably want to chat with the entire staff with, and then MIPS training and portal training, which we also want the whole staff for.
new glasses with RX. New glasses RX given today. Finish. Okay. Those are done. Okay. All right. I told you she's gonna be my new right hand. I'm your right hand and she's mine. Just dwindles down. Okay.
Okay.
What next, Morgan?
Do we get kind of a good idea of how to customize these pieces? And then
Yes.
I also would like you to go ahead and go to the options drop down and go to EyeMD EMR help. And then on the left, go to contents tab and hit the little plus sign to expand that. Go to configuration and customization and expand that. And then there's a fast plan one that you can expand. So it'll show you what a fast plan is and how to customize what each field means. So this is also a good resource for you to go to while you're customizing, to kind of take a look and get reminded of how to do things and what each piece means.
Okay.
Okay. So let's jump in then. Let's go ahead and close or minimize out of this screen. And let's jump to the plan tab. The next thing we're going to do is talk about doctor letters. So at the very bottom of this screen, there is a letters button, and you're going to find that the customization through this system is actually just doing it. So all the customization works the same way that you would do it when you actually do it. So go ahead and click on letters. Letters, very similar to fast plans, have a list of pre-built letters in the system, but you also have a share cloud. So not only do you have the ability to view what's already built in, but you can see what other doctors have used. There is one particular letter that I think a lot of our doctors took advantage of at user group last year, which was the diabetic letter shared by Dr. Holland. So if there's a letter that you want to look at, if you go through some of those and you see the credits and it says Dr. Jeanette Holland, she's got very good diabetic letters that her providers very much have liked. So just kind of a heads up there. What I would do is, if you have a list of letters that you, I would print them out, and then you can kind of customize and look at your letter and customize these to fit it. So let's go ahead and just find a basic letter that you would use a lot. Like you could use referral letters, otherwise in the drop down up at the top left, they're broken down by type of letter. So you could click all to see everything, you could click different options, but we'll just go through how to customize one of them.
Like right there where you
Right.
right there.
There's a list of what's currently built for all different types of letters.
Right here, you can type in diabetes or whatever. I'm guessing to narrow the search.
And it just depends on the description of the letter. So like DM maybe for diabetes, someone may have written out diabetes. So it just kind of depends on what the, yeah, so they're probably not going to have any letters in here. So you may want to search like DM. They're just already, they're in alphabetical order as well, but there's just some examples. Otherwise, under Share Cloud is also an option for you to go in and take a look at. And then you can search description as well.
How would you find Dr. Holland?
Under credits, see if you can type in HOLLAND and hit search. And then see if there's, yeah, so she has a few different ones in there.
Cataract was wrong.
And then see down at the bottom, credits Jeanette L. Holland at Holland Eye Clinic in Kansas. So these are ones that she also uses. Now, it was mentioned before to me earlier that you guys don't have a logo. Is that correct?
We do not.
Okay, great. That's just what I wanted to make sure of as we go through and kind of take a look at a few things. So go ahead and...
Like, on the letter, I'd just like to be listed as James W. Bedsole, OD.
Okay, perfect. That's fine. Yep, I'll show you how to customize that. So let's go ahead and I'll give you a few minutes to find a letter you want to customize. If you find one from the Share Cloud that you like, you just hit the download selected letter template at the top. I get the question sometimes is, does this cost anything? No, this doesn't. This is included. It's just an extra resource for you to use to try to save everybody some time from going through and manually customizing.
Okay.
Yep. So anywhere that you see that Share Cloud little thing, you can always look in it. You can always use what's there. No problem at all. All right. So is this the one that you'd like to customize, or did you want to just take a little bit more time and take a look through them?
Let's go ahead and look at cataract referral.
Sure. So you're still in the Share Cloud, so I'm going to have you uncheck View Share Cloud Letters to get back to your main option, and then go ahead and search for that cataract referral. It's already highlighted, actually. So do you see how it's in alphabetical order there?
Mm-hmm.
Okay, so let's say that we want to customize this letter. Down at the bottom, there's a little button that says Edit Selected Template. Okay, so it brings it up very similar to a Word document. So all of these little pieces surrounded by these little sideways carrots they're called tokens or text fields. So what it means is, like, starting at the very top, if you had a logo, the logo would replace that text field. You guys don't have a logo, so my suggestion is to delete that text field and type out James W. Bedsole in whatever font, bold, however you want to do it, just like a Word document. Okay.
You can change the text.
Yep, it's just like a Word document. So up above you can see this is Arial at 10-point font. There's bold, italicized, all those options you can certainly go through and basically just use it as a Word document.
Okay, if it works like a Word document, if I put the cursor at the very beginning of James and I change the type of font, it changes the whole letter, or do I have to highlight the whole letter?
I would, oh, you're going to have to highlight the whole letter for that. Yeah, this certainly isn't the new Office version. It works similar to Word, like Word, but it is not Word.
If some of these things are lined up certain ways,
Okay.
if we change the font, it's going to shift stuff.
If you like finish this out and then highlighted it and then went up here, it'll only change that.
I know, but he was wanting me to change the
Don't
font
worry.
on the whole
Don't
thing.
worry. Let's just go with this.
So is this?
So what I
that's-
would do is then there's the site address, city, state, zip, and phone number. That'll all come in based on what's built in the background of the system. Letter date will automatically fill in with today's date. Now here it says eye care provider, full name, address, city, state. This is if you entered an eye care provider on the add new visit screen. Otherwise, this comes in blank and you'd have to add the provider from your referral provider list. So It's up to you if you want to keep that option there. I would, or you could change it to, and I'll kind of show you how to change the text fields, but just be mindful if when you add a new visit, if you add a referring primary or eye care provider, that's what automatically fills in from the letter. If you don't, that's okay. It just goes blank, and it'll allow you to add up at the top right where it says insert doctor address phone, which we're not going to click right now. You could just add it manually from that list.
It would have to be here because we don't know what doctor we're going to send them to until it's all over and done with.
That's perfect. So you can certainly delete that portion for right now if you want to.
This font to match this font. Because this sounds Roman and this is
I would probably worry about the font at the very end.
Okay.
I would do the bulk of what's in the letter, and then I would worry about how it visually looks.
Does this not pull off of our stuff, or do I have to physically? This site address and stuff like that, that automatically pulls off of our stuff. I don't have to manually type it, do I?
Right. Remember, the tokens they're going to be filled with the information from what's in the system. So like patient first name, patient last name, date of birth, and then patient date of birth. You don't fill that in. The system will do it. What we're looking for is just to make sure that how it's organized is how you want it to look. So,
yeah, I'm just meaning, I knew that part, but up here under the top for where we changed the logo to Dr. Betzel's name, the site address pulls from his information on our address, right, built in the system.
Yep.
Okay, that's what I was asking. That's what I thought. I wanted to make sure.
Okay. So then it says patient first name is a patient age, year old, patient sex lowercase, who presented on date of service date with decreasing vision and symptom from progressing cataracts. Ocular history includes, and then it says insert their past ocular history. So basically you just have to read through this and reword it however you want. Okay. Now, let's say that you needed to add like a text field. So what I want you to do is I want you to take out PMH, past ocular history, with the carets, because I'm going to show you how to re-add it in there. Okay, delete one more time so we get all the carets. Okay, so in here, let's just say we put ocular history includes, and rather than making everybody free type it out, we're going to just include the text field. So at the top left, it says insert text field. Top left, yep, there you go. And then it's all broken down by different sections. So in here, you could get doctor, imaging studies, patient procedure. I would click under tech. I don't have these memorized by any means, but I'm just going to go by what makes the most sense in my head. So tech, past medical history, and then past ocular history with details, or past ocular history. So it's up to you. So like past ocular history with details is if you put which location, what the surgery date was, if you added additional comments, or if you just wanted to say glaucoma.
That's what it is. We're putting it in.
And then add. And now do you see on the left-hand side how it put in that filter?
Yes.
Okay. So let's go ahead and hit done. And then you could read through the rest of the letter. When you're done with this, you can rename it on the right-hand side where it says letter description. Right now it says cataract referral Holland, but we don't really need it to say Holland anymore because it was great there when we were searching for it. But for right now, I would rename it so it goes into your letter filter list as cataract referral, and you can take out the Holland piece.
Well, it's going to be ours. It's going to be in ours. And I can fix it so our list will be the favorites at the top.
So what do you choose?
In the, right here, right side.
What are you looking for? Yep, that's where you change the name. Yep.
Cataract referral. I see what you're saying. Now I know why you said that. So if we're looking through the whole thing, just so we know where our stuff is. And then save.
Well, do you like the letter?
I can go back and edit that letter later.
Absolutely,
right?
yeah, and that's what we're going to have to do when you have that hour to customize, just so we can make sure we get through everything. So here how it says warning, template is being modified. It's just your heads up to say What you're changing in here is changing every patient's letter version of this. It's changing the template, not just specific to this patient. Go ahead and hit save. Now go ahead and select that letter. So I would probably go to referral letters just to make the list a little bit smaller. And some little tricks I use in here for these letters are like I would put a space at the beginning of the ones I use most often so they go to the top. Or I would start them with bedsole or whatever the case is to kind of group them together. Go ahead and hit use selected letter template, and that'll just filter in the information for this patient so you can take a look at what it will look like. So that's what will come forward. That's what it looks like when those tokens are built in. Now, of course, we are using this on a patient that is a fake patient. So remember, at the end of the day, these Foxfire that are in all caps, today at the end of the day, they're being deleted because they aren't part of your interface. So I have to get rid of them entirely. So when you have a live patient, it will say Morgan Cooper with the correct capital M, capital K, and everything else lowercase. It's not going to look this obnoxious, so to speak. So just,
and it would have glare test, super 10 hole.
Because we edited it, yeah.
Ham, yeah.
Now in here, let's say that, sorry, go ahead.
The alignment, like under manifest refraction, where it's not exactly lined up, we edit that under the template.
Yep, under the template.
Okay.
I like that font.
Yeah, this
and
is
then this is also, this is the area, so you knew how to edit the template. You're not editing the template now, but if you want to go in and change where manifest refraction is so that it lines up, you can go in and do it here. It's just, again, treated as a Word document here where you can edit it.
Okay.
Okay, so a couple things I have on here. Number one, do you guys have any type of a tablet in your office, an iPad, a Microsoft tablet of any kind, or does anyone have one that we can use to get doctor's signature in the system?
Yes.
We have an iPad.
You do? Okay. What I would like to do is get the system set up on that iPad so that you can electronically sign these so that you don't have to print them out and physically sign them. Down at the bottom right-hand side, there's a little button that says Insert Employee Signature. We build your signature in the background so that when you sign the chart and you sign letters, it's an actual signature that just says electronically generated. That way your actual signature is stamped on the RXs and the letters and so on. So that's one of the things that we're going to get built for you.
Okay.
The second thing, okay, we know we don't have a logo, so we have that figured out. The second thing is if you want to share these letters using direct messaging, we have to get you set up with a direct messaging address. So I am going to pull up this option. I'm going to add it for you. You need to choose what you want your email address to be. Now the domain is standard. You can't change that, but you would choose, for example, do you want it to say Dr. J.W. Bedsole? Do you want it to say James W. Bedsole OD, Dr. Bedsole? You choose kind of what the beginning portion of it is, and then I will provide you with what your email is that you can send to other doctors.
Now this is where only Dr. Bedsole can send this stuff, right?
Correct. So this is doctor specific.
And you send it directly. Now if you want me to send them and fax them, it's theirs done differently.
What if we just go with J.W. Bedsole for the introduction?
Okay, perfect. So let me.
J.W. Bedsole OD. Is that
J.W. Bedsole OD. Yep, that's probably the most common that I see is J.W. Bedsole. So I don't have that activated until the 15th. But what it will be when it is activated, and I'll give you the whole thing right now. Give me 1 second. Oops. Is it'll be J.W. Bedsole OD at direct.imdemr.com, and I will send that over to you in an email. And that will be your direct messaging address. This will be active as of 04/15/2017. JW Bedsole OD at direct EyeMDEMR.com. Perfect. Sent. All right, so for letters then, a couple other pieces that you can do if you want to go ahead and you can save this if you want to or just cancel out of it. There are going to be opportunities, go ahead and hit doctor letters again, where you may want a letter and then you may want to duplicate it to make like a copy of it. So to do that, basically what you do is you're going to go ahead and find a letter.
Where's diabetes? Oh, there where it says bedsole. Round 2.
That's cataract referral though.
Oh, never mind. You'll have to go to that hall and over.
Well, you already replaced that, remember? You replaced Holland, you renamed it Bedsole.
So you wanted me to go back to the cataract referral one? I thought you was wanting
No,
me to
it
look for
doesn't matter. No, any letter. So you can just pick like DM letter to PCP female. You can pick any of these. It doesn't matter
Okay.
which one. Yep. So there's a couple different things that we can do here. You can hit edit selected template and make changes like we talked about. Go ahead and hit cancel here. And I'll kind of show you a couple other options. You can hit delete selected template if you're never going to use this letter and you don't want it in there. Or you can click create new template from selected. This would allow you then to create a new template. You can rename it and it will basically just make a copy of it for you. So same kind of options you had before. The best thing to do is go through and like delete the ones you don't want. That's how I always start, but again, you can do them however you choose to. And then what I would do is go through and edit the ones you like, and then if you're saying, okay, I'm missing this type of a letter, you can either create a new letter from a template, or there is an option to create one entirely from scratch if you want to do that. And that's what the blank one is at the very top. So if you click blank at the top of that selection list and then create new template from selected, it's just a blank sheet of paper that allows you to just start creating it from scratch.
Morgan, when I do a referral for cataract surgery, I have some patient consent forms that I have the patient, that I review with the patient, where we talk about selecting a surgeon, the type of implant, fact that they're going to need glasses after surgery, and then another one for post-operative care where they make a selection for post-operative care here. How do we handle those things in the new system?
So do you want those to be something that you print out that are letters? Do you want them to be something that...
This is something I have the patient sign in the exam room. I pull it out as part of my patient education in the exam room.
And do you want to use like a signature pad or a device to sign it, or do you want it to just be a paper copy?
I think
Signature pad, less paper. We can have it scanned. We can have it scanned in the system, and once they sign their signature, the signature goes on all their documents. Is that not correct, or is that something different?
That's not correct. They can sign each document electronically in the system, but they don't just sign the pad and it automatically goes to every sheet, because we can't have them sign something they don't know that they're signing. So
can we use was it a separate kind of pad, or can we do like the electronic documents? Like if we do the consents, can we use the iPad that we have?
Yep, you can use it on the iPad if you want to do it that way. Which is what that insert signature tablet means. So you would pull up the patient, if you're going to do that in the EHR, otherwise in the practice management side, there's an option for that as well. You would just pull it up, pull up the letter, insert signature tablet, and just sign it with the tablet. And they would just use their signature or their finger or a
The little pen.
Yeah, like a little stylus.
I forget what those things are called.
So what I would do is I would probably get set up with our letters, and then what we can do is talk about how the best way to do that is. One of the pieces that Chris is going to get set up with you when he sets up all of your devices is that signature pad. So at that time we can decide, do we want to utilize that signature pad? Do we want him to sign it in the exam room with a tablet? And if so, we'll get that on there. He'll also help you get your signature onto the tablet.
Good. Let me just do it right here and then we'll walk on what to do. Okay.
Okay.
Yeah, we'll definitely want to do that.
Perfect. Any questions on the customization of letters right now?
Got this ready. Whatever you have to do, download the app. So we just
Not right this second, but we'll have to definitely
I just need to
know how to, I guess I can,
for you to sign.
if we manually make these up right here and then you'll have to, I don't know. We can manually make the document and then where they need to sign it, you can click insert signature tablet and
Yes.
save, right?
Yep.
Yes.
Okay. Just like the, okay.
And you can do
More-
that now too. If you hit insert signature tablet, it's just going to ask you to sign it like with your mouse. Yep. And then you could just sign in the box and
Okay.
you can just use your mouse and hit accept and you can see exactly what it will look like.
Okay.
So,
And it'd be there.
yep.
Morgan, I've got my iPad in my hand here.
Okay.
Jennifer's downloaded an app, and it says the choice is now on the desktop, or desktop, remote source, Azure remote app. Are we in the ballpark here?
You're going to want to download that same Microsoft Remote Desktop application.
She did.
She did.
She
Okay.
says.
And then we'll have to, do you want to do that now? And update?
Mine as well. Got it pulled up.
Okay, one second. I got to grab your IP address. So when you get into that app, there's a little plus sign at the top left.
Yes.
Go ahead and hit the plus sign, and it should ask for the connection name. And you can put Foxfire PM or EyeMD EMR. I guess it kind of depends on what you're going to use on it. When we did it here, what we did was, I'm actually going to request keyboard and mouse control, Tammy, and I'll kind of show you because we can walk you through it on the computer. Did you get a?
When I hit the plus sign, it's given me add new,
Yep.
and it says desktop remote or the Azure remote app.
Okay, give me 1 second. Let's just pull it up together on the computer. Tammy, do you want to minimize Foxfire entirely with the blue bar across the top? Or yeah, there you go. So go ahead and minimize that.
How do I minimize this one? The green one here. No, that's correct. It's right here. I'm gonna.
And then you can use the yellow one. And go to that remote desktop button at the bottom, that little red, there you go. So you see the new plus sign on yours, just like we see on the computer here. Is that right?
Let me get that out of the way.
Tammy, go ahead and hit new. I think that's you that's driving.
Well, it's Jennifer.
Oh, Jennifer. Okay, go ahead and click new.
Okay, there.
So
It
connection
says-
name is where you'll type in, and I actually go ahead and type in Foxfire PM. So just like you see it over on the left-hand side. And actually do this, well, that's fine. No, go
Which
ahead
one?
and hit the red X here. I think I'm driving, I'm not sure, but, oh, you want to click, yeah, close that. Does it let you? You might have to delete it. Try deleting the connection name entirely, and now close it. And highlight Foxfire PM and EyeMD EMR and hit edit. So basically what you want to do is match everything to what you see on this screen.
Okay, under desktop or remote under desktop or remote resources.
Remote.
I guess I'm not sure what you're looking at.
Okay, it just
Click
I'll try. It says PC name, so I'll put that in.
Well, make sure connection name is Foxfire PM and EyeMD EMR, and PC name is the IP address. So just like it shows up on the screen on the computer.
Tuesday, 389. So user account, is that the Foxfire PM?
I don't know. Does it not look like this screen up on the computer?
No.
Okay. Then I'd have to actually see it. And our iPad is with a client right now, so unfortunately I can't try
What's
to.
underneath where everything's filled out, connection name, PC name, gateway, where it says credentials.
Yep, you don't have to fill any of that.
Your name and password.
Yep, you don't need any of that because you're going to enter it when you log in.
Okay.
So see if just with the IP address you can save it and then see if it lets you log in.
Okay, and it asks for the username and password.
Yep, and so go ahead and put in your Foxfire username or password. Did it let you log in?
Well, it said I don't know whether it messed up the caps or something. It didn't like my password or
Okay.
username.
So you're just trying it again?
Yeah.
Okay.
Morgan, it's Tammy and Cindy. We have a quick question on verification. Sure. We just want to make sure we were correct. As far as doing all of our quote unquote homework being done before we go live, but it cannot be being done while y'all are doing the conversion. Is that correct?
So next week, Tuesday, Wednesday, and Thursday, you will not have access to Foxfire.
Okay, that's what we were thinking. We're just trying to figure out the timeline.
Okay.
All right, thanks.
No problem.
Okay, it's coming up for the username. It's got the Fox ASP-BE12-12, and then it's got my stuff out beside it. Do I need to keep that on there, or just log in like I would log in?
On the username, let's try this. Try deleting everything and typing in B as in boy, R as in red, L as in Larry, and / and then type in your username. We should only ever have to do that BRL part one time. But let's try that and see if it lets you log in.
Okay, it did.
Perfect. So now what I want you to do, and we might as well just try to do this right here, is go ahead and double click on EyeMD EMR, and you're going to need the doctor to sign in. And I'm actually going to show you what that's going to look like, to walk you through it on the screen as well. So let me know when he's logged in.
It's so teeny tiny.
What's my,
It's like you would use on the computer. Whenever you log in on the computer.
I don't know what my login is.
No, you
What's
should
my
just have to, so someone logged in already, right? And
I
then,
logged in with mine.
yep, so
Now it's,
now double click EyeMD EMR.
I did. And it's
And now
got that
just-
box.
Yep, so now just doctor logs in with just the EyeMD EMR login.
Which is what?
That's the password I emailed over to you. Who logged doctor in on the computer?
Just the numeric password?
Yes, just the
This should-
numeric password. Yep, you got it.
Yours first. So whatever with your username.
What's my username? I don't know.
You just select your name from the drop down.
You'd be able to select it. There you go.
James
It's just
Davis.
little.
Okay.
Okay, let me know when you're in.
Okay, you're in.
Okay, go ahead and go to the options drop down and select employees.
Okay.
Go ahead and highlight the doctor's name and hit edit employee. And just so you guys know, only doctor has access to this portion of the system.
Okay.
Once those details pull up, here in the middle, there's a signature option. You can click Edit Signature Tablet, and then you'll have to sign in that adorable little box.
Is that in the security settings? Or where does it say edits?
Right here. Do you look see on the computer?
I'm sorry, I wasn't looking. I was looking
That's okay.
down.
Did you find it?
Yes, yes.
Okay. And then there'll be a little signature box that will put the signature in. Sometimes what I do is I try to kind of maximize the screen, and it takes a little while to figure out like the best way to view it. But that is where you will have the doctor enter the signature.
Jessica went to get a stylus for him, so he could
Sure.
sign.
No problem.
No, that's good. I'm glad you did. It's a good time, perfect time to do this. No time like the present.
Y'all were editing letters. And
Yeah.
Sandy said you could use it, but you can't have it.
I don't know about that.
that looks
That's what I do.
okay.
All right, and then when you're done, just hit, do you see it in this box right here?
Yeah.
Okay, hit the close the door option. Let me know when you've done that, and then I'm just going to make sure we can see it.
It's closed.
Okay, let me just take a quick gander. Perfect. There it is. So now that's done. Now if we go into the letters we were just looking at, and I'm going to let you guys kind of drive here, but go ahead and click on the letters option and find one of those letters that we want to use. Doesn't matter which one, just grab any of them and hit Use Selected Letter Template. Go ahead and click your mouse under where it says Sincerely. And then you'll have to scroll down on your screen here, but we're looking for the little piece that says Insert Employee Signature on the bottom right. And then just hit Insert Signature. And there it is.
Okay.
We have to do something because otherwise it's going to take up 2 pages.
It depends on the letter. You may have to look at reorganizing some of the, you know, the font and things like that.
I think she was saying that we were going to take this top part out because we wouldn't know until the end.
Well, just keep in mind that if you go to insert doctor address / phone there to put the doctor you're actually sending it to, it will expand that list again.
Yeah, okay.
Kind of be mindful of that as well. All right, so we got that part done. That's awesome. So now we have your signature in there. You guys can also use that, you know, pull up a Foxfire patient, pull up this letter, and click the Insert Signature tablet. So on some of these that require a patient signature, I'm just going to drive really quick and see if I can find one. Consent forms is usually a good one. So patient signature on here, you can pull any of those consent forms up and then click Insert Signature Tablet and just try to use it with that, you know, stylus and what you have, and their signature should enter in there for you as well. So if that's something that you want to do in the exam room, that's where we would do that.
Where it says witnesses, do we need to put our signatures in just like you did with Dr. Bedsole so we can just click our name and insert it?
That's, oh no, only the provider will have the signature in there. Yep. So only the MDs and ODs have the opportunity to have signatures in there. If you got, do you guys do witness signatures?
Well, this letter has witness on it. The looking at.
Yeah, this one could mean that the clinic that used this one did a witness signature, but if your clinic doesn't need to do that, or if, let's say, usually what that would mean is like the patient has like someone with power of attorney or something that they use. That's just what that is. I haven't seen any of my clinics utilize the witness signature option. They usually just delete that and have a patient signature and a guardian signature.
Okay.
Okay.
Oh, CDAL not space the part there. Are we saving this or this is just play? This is just play. Okay.
So I'll give us a few minutes to kind of take a look at some of the other options for the signatures. And then the last thing we're going to do before we head to lunch is going to be the visit types.
So did you see how I inserted it?
Here, you sit here. I want to see what you're doing. I'll watch you.
Okay, so I have to go to letter and then say we want to do that all.
Mm-hmm.
And then you're going to select it. Okay, and then down here on the bottom, you're going to put his signature. Oh, hold up. I got to put where I want it at. Sorry. You just keep the mouse there. And then select it. That's always going to be him. And then it's put it in there.
Okay.
And you may have to take a space out or something like that so that it's not on 2 pages because otherwise it's going to put that one on the 2nd page.
Okay. Is that it like a normal Word document?
Yes, you just take out a space and it'll pull it back up.
Well, that one's a little bit different. That may wind up being 2 pages because that right there doesn't have the referring doctor and all that stuff built in. Okay. That's all you have to do.
Okay, I think we're ready to do whatever else we got to do.
Awesome. Let's go ahead then, and we're actually going to go to the options drop down for the next one. What we're about to customize is the list of visit types. So when you click the button that says Add New Visit on a patient, the list that you can select from is what we're about to customize. So on the left-hand side of this screen, you're going to see the list of what's already pre-built into the system. What I would do is I would start by deleting what you are not going to use. Most commonly, that's going to be under the procedure related, but we don't even see that list when we add a new visit because we aren't adding any surgeries. So under regular office visits, that's where we're going to focus our concentration here. The only rule that we have in here is that you cannot change, edit, customize, delete anything that starts with pre-EMR. That is what all of your exams for your conversion go into. So if you delete them, you won't get any exams. So please do not touch pre-EMR chart or pre-EMR contact lens. Those have to stay exactly as they are. But let's go ahead and highlight comprehensive. So here's how this looks. At the very top is the name of the visit type. So you have the ability to change what you want this to be called. Going down from there, you have tech, diagnostic tests, and doctor. This is the list of tabs on the left-hand side of each visit. So what this means is, under the tech or HPI/tech tab, the tabs or the check marks below there are the screens or tabs that show up across the top. So again, tech, diagnostic test, and doctor are down the left. The check marks underneath of them are what's across the top. So on a comprehensive visit, you want to be able to see chief complaint, POH, PMH, ROS, vitals, workup, workup 2.
Mm-hmm.
If on a comprehensive, you always want sensory motor or gonioscopy to automatically appear rather than clicking that add tab drop down, if we remember that, then you would just check mark sensory motor and gonioscopy. Same thing with doctor. On a comprehensive, the doctor tab has all of the tabs across the top already visible.
Mm-hmm.
Any questions on that particular portion?
No, this is the things that highlight in yellow, correct?
No, this is just the tabs that are available.
Okay.
Okay. Any questions on that one?
No.
Okay. So then what we'll do is we'll go to the items that are highlighted in yellow. To do that, you have to go to the Highlight Fields button.
Where's that?
So underneath diagnostic tests, in between tech and doctor, there's a button here that says Highlight Fields.
Thank you.
This then is each of the items under the HPI/tech tab on the left. Each one is broken down by the fields that can be highlighted in yellow. So what this means is all of the pieces in a comprehensive visit that are checkmarked are going to show up in yellow during that exam. Does everybody remember what the yellow highlighted fields are used for?
What you have to fill out. What needs
Yeah. Yep. So basically it's, here's what the doctor wants to be filled out in this type of exam. It's also going to be used as kind of like an efficiency feature. So like in workup, as soon as you do VACC, it jumps to VASC. And so it kind of jumps through the highlighted ones. Just a couple reminders on the yellow highlighted fields. Let's say we have W highlighted, but I've never worn glasses before. Just because it's highlighted doesn't mean that the system is going to stop you and say, hey, you didn't fill this out. It doesn't do that. If they don't have something and you don't complete it, that's fine. It's just to help remind you of what to try to gather. Likewise, if you don't have dominant eye as a highlighted field, but we want to gather it for this particular patient, even if it's not highlighted in yellow, you can still go in and document in that field. So the yellow highlighted fields are meant for a reminder to just help you say, on this type of visit, here are the important pieces that we want to make sure we add. So the goal here is going to be to go through your comprehensive visit. You can name it. It's like some people have a comprehensive new versus a comprehensive established. You can add different ones. You can customize in different areas. Go ahead and hit the close button here so I can show you a couple other pieces. So we know how to rename. We know how to make the tabs appear and how to highlight them. Down here at the bottom are those customization features for Workup 2. You can either choose to have a tree view or a drop down. So 1 through 10, if you were to click on it, it will give you a tree, like a double drop down and a whole nother window opens. I very strongly suggest using the drop-down option on this screen. So for example, color vision, you may want to just type in, and this is only going to give you the title of the drop-down, but you could type in color vision, and then maybe if you want stereo across from it, you could type in stereo. If you want to put in working or reading distance, however you add them here is how they show up on that workup 2 screen. Now before you do this, I want to just talk about, let's say in custom 11, you type in color vision. 2 things need to happen. You need to decide if you want it highlighted or not. Where do we highlight fields at?
Up top.
Okay, so go ahead and click on highlight fields. Now if on workup 2 you want custom 11 highlighted, you would just check custom 11 there. Yep, so then color vision would be in yellow. Now the next thing is when color vision, it's a drop down, but you have to customize, so it's like 1 out of 10 or 2 out of 10, 2 out of 8, whatever your scale is. Do you remember how we customize the drop downs?
Nope.
Not right here.
It's not in this screen, that's right.
Right here. Double click.
In the exam, how do we customize a drop down?
Double click it.
Perfect. So we can add the title of color vision here, but I'd actually have to go in and add a new visit, go to the workup 2 screen and double click on that drop down to customize the template for my color vision selection list. Does that
So
make
I do
sense?
this here, but then go to the exam to do the other part.
You got it. This just adds that as a field.
Okay.
So put that and then put the other
NPC.
beside it.
NPC. Okay, now we need to get a highlight.
Hold on. We might want to come test in there too.
Oh, yeah. Instead of us doing those confrontation visual fields like they were, because it's
Instead of doing the EOM.
the EOM like it is, do it the other way. Wasn't that on there? Confrontation visual fields full.
Cover test.
Oh,
Instead of doing all the EOM.
Can you take that out?
no, you can't take it out. You can't take it out. It's there. Let me do this before I forget. 11 and 12. Close. Because I want to now to go to the exam if we want to fix these drop downs, because I want you to show us how to do this, and then we
Okay.
can decide if we're
Close the door
close. Go like that.
and then go ahead and add a new visit.
Add a new visit.
Back here. Down here. Oh, wait. Oh, sorry. Down here. I'm thinking add new visit way up here. Go back to doctor.
Add new visit.
Down here. Oh, right here. Sorry. Thank you, Jessica. I told you you were going to be here with me.
All right, add a visit or add a type. Comprehensive.
Mhm.
And then I have to mark this text edit, right?
Yeah. Add that. Yeah. Do that.
Do this first, right?
And
And then us. Don't you wish this was touch screen?
I do.
Go ahead to the HPI/Tech tab and get to our workup 2 screen. And there they are. So this one has some pre-built in it already, it looks like, which you can choose to delete or override or keep.
Normal or abnormal?
Let's add normal
Color effect.
and cold effect. We'll add to.
You selected. Oh, that didn't work.
You highlight it.
Oh, I don't know. I thought I'd do it here. And then you select it. I don't know. So I did it earlier. Okay, what am I doing wrong, Morgan? Because I thought I clicked on this earlier, had that right there, and then that. It's not working.
So right now you have color defect and it wants to know, are you adding this item or what is this done?
Yeah, it's already at the bottom.
Okay. So then what I would do is I would come in here and just do this, and then normal, you just want to move it up.
It's not moving up, though.
Let me try to I'm just going to try to refresh it because I don't know what's not working for it. So So we may not be able to move that one up. I don't know why. Oh, well.
Actually, we can take care of it this way. We can delete every one of these.
You'll have to
Because
do
we
them
don't
individually.
PowerPoint. We do normal or color defect. So I can
So what I
delete
would
every.
do is I would actually just, up here, I would type in normal, and then under 1-7, type in color defect, and then just delete the rest of them.
Oh, because it'll leave these lines
Yeah,
blank.
it'll just replace it.
Normal. Color.
Yep, and then go to the next one and delete. And the easiest way I find to do this is start at the bottom.
Oh, okay.
And then hit delete. Just keep your mouse there and hit enter. Delete.
It automatically throws me back to the top.
And then hit enter. Okay, you can do it with your mouse too. I was just trying to help. So there you don't.
It throws her back to the top
It
every
throws me
time.
back to the top every time.
If you select the bottom one, I think it stays at the bottom. It does when I do it.
No, it still throws me back at the top. Well, it was a minute ago, was it not? I
So what
swear we
I
were doing.
do is I just keep my mouse on the deleted and hit delete, enter, delete, enter, delete, enter, delete, enter, just a quick key. Yeah, that's how I do it.
Oops, I deleted
So
it.
just want to make sure. That's okay.
Press it back up. And then color defect. And then this delete. And this one delete. Yes. Okay. Oh yeah, it's 12 o'clock. So close door.
Before we go to lunch, I just want to show one other area. If you want to go to the options and visit types.
The top.
Yep, we're going to go back to the customizing.
Options, visit, types.
All right, so you know how to customize what's already there. For example, like premium IOL post-op, will you use that visit type?
Yes.
Okay, so find one. Is there one over there that you won't use? Even if it's at the bottom, we can, like, will you do Botox?
We don't do any of the injections.
No Botox.
So go ahead and highlight one, and then at the top, kind of right middle, there's a delete visit type. I just want to make sure you know how to delete one.
So if I'm going to select this and delete all this because we're not going to do injections, will it select that whole thing because I'm not the parent?
Well, you're on the parent, but it's not expanded. So it'll delete everything under the parent if you delete the parent, but it won't delete like cosmetic dermal filler because they're not connected.
I'm deleting this, right?
I'm not going to do muscle surgery.
Okay, that's what I'm like, we're deleting it. Okay, so now I have it highlighted over here. And then
delete visit type. And then
warning, are you? Yes, we permanently want to delete that.
So again,
Yes.
just no way to accidentally delete anything in the system. It's just kind of a good reminder for that. So that is how you would delete one. If you want to add a new visit type from scratch,
Okay.
to do that, down at the very bottom left, you can type in a name. So let's just type in test.
Okay.
And hit add visit type. Now, there's one extra step you have to do in here. You know how to do the tech diagnostic doctor, but to the right of that, there's a visit classification. When you start them from scratch, you have to select regular office visit. Everything else is exactly the same. Okay, so really quick, and then this is all that we have for this portion of this morning. If I'm on this test one, can anyone tell me why I do not have the option to customize workup 2? Anybody know why that might be grayed out? There you go, very good, yes. If it's not check marked on the left, you will not have the ability to customize it at the bottom because you don't have that tab even existing in that visit type.
Yeah.
So I get that question a lot in case you get stuck. Yep.
Like in contact lens exams, we don't need that, we don't need that, and we don't need that. We need that, and we need workup.
And then you'll need the lens RX.
Well,
The doctor. doctor, and then we'll need the bottom stuff, all that stuff in the bottom. But we don't,
And the fundus.
yeah, we'll need that and that. We just won't need fundus and slit lamp.
We're just, like, if this was the contact lens exam, this is what we would need. We're showing Dr. Bedsole. Actually, Jessica is showing me, and I'm showing Dr. Bedsole. Okay, that's what we would have to have, because you have to do the plan, the assessment, the coding, and the workup. And this is where we do,
What would you bring off?
okay, and the workup is where
show
the facts.
centration.
You can type it in notes at the bottom of exam, or there's somewhere within the slip lamp and stuff that you can do that. In fact, there might have been a tab. There might have been a place on that. We'll have to look. Okay.
So that is what I have for this morning. What we'll do is we'll go ahead and do our break for lunch, and then from 1 to 2, I'm just going to basically give you that hour to customize any area that you want to do. If you do want to break it out and say this person's responsible for visit types, this person's responsible for fast plans or letters or whatever, multiple folks can be in there at once.
That's right. Now you're going to close out that one.
Save it. Now, okay, let's see, hold on a minute. Now, let's look at, where can I do the visit type to look?
You can change the visit type. Go to
Edit patient.
Yep. Nope, that's not it. Go here. Visit summary.
This one? Oh, this one.
And then you're going to go to edit.
Edit. Nope.
Remember, edit only opens up the buttons if they need to be opened. So this is today's date of service, so yeah, we wouldn't have had to hit edit there.
She was
Okay,
trying.
You're going to go right here.
Is this one?
And then you're going to push the contact lens.
We want to see if what we edited on the contact lens exam stuff is what we want it to look like.
Sure.
And then you're going to go here. Here.
Oh, sorry.
Show you. That didn't work.
Well, that's your chief complaint, or you can do it here. I want to see this first, though. We can play with that part.
But we had taken out the ROS and all this stuff. We didn't want to see that stuff.
Oh, that's true. Those tabs are still there.
It still says. No, it says
Once we edit a what do they call it? My mind's not completely blank.
a visit type.
Yeah, once we edit a visit type, and if I hit close the door, was I supposed to hit save somewhere before we hit close
Nope.
door?
Close the door is save and close.
We have to, that was already an exam, an existing exam. We have to add a.
So I can show you a quicker way to, like, if you want to see what you just updated, go to the
Yes, please.
HPI/Tech tab.
Okay.
And then go to the Workup 2 screen. See that little Change Custom Template button just to the kind of bottom right?
No.
So right here, there's a button that says Change Custom Template.
Oh.
So
We're
what
at the
this will
very
do
bottom.
is if you click on that, it'll just swap the bottom. So it's just going to delete all the information collected in each custom field for the record. Hit yes, and then it'll give you the list of visit types. So you could click Contact Lens Exam and hit Change Workup to Custom Template, but there's nothing in there. It doesn't look like.
That's not.
That's not where we're at. That's not what we were after.
What were you
Yes.
after for the changes?
So we went in and we changed the contact lens. We changed the exam to a contact lens exam. But I think it's because, here, let me see this. Hold on. I think it's because that was already an exam. We already had it up there.
There it is. Look,
So see,
there it is.
yes.
Oh, I see. Okay, when you went into the edit visit, I see. Yeah, it just shows up on
We
the
wanted
left.
to see, yeah, if it actually showed up what we were actually wanting.
So it'll
Okay.
just show you this, this, and this.
Now, I have a question. Like, once he looks at somebody's contact lenses on them and he sees that it's good centration and movement, where do I put that information, or do we have to add?
That'll be after lunch.
Okay, all
Yep,
right.
we'll go
very
through
good.
that. So I have a conference call I have to jump on here, so I will close out of this GoToMeeting. We'll get you another GoToMeeting at 1 o'clock, and then we'll resume training at 2 o'clock.
All right, thank you.
All right, talk to you then.